machine has a problem solving. It contains artificial intelligence. طب ايه هما ال types of artificial intelligence؟ في عندنا 3 انواع: artificial narrow intelligence, artificial general intelligence, و artificial super intelligence. ال artificial narrow intelligence refers to AI systems that are designed to perform specific tasks and are limited to those tasks only. These AI systems excel at their designated functions but lack general intelligence. زي ايه example ليها؟ زي سيري، زي أليكسا، زي الفيس ديتكشن، زي الفينجر برينت. سيري ديت عبارة عن فويس اسيستنت، عبارة عن virtual assistant will access your contact. لما أقول للتليفون call mom بيidentify الورد mom من الكونتكست بتاعتي وبيعمل calling النمبر. نفس الوضع مع أليكسا. To interact with the technology we use every day، بقول لها set timers، change the current weather، access Wikipedia articles، play music، home automation features. كل دول example ل weak artificial intelligence. طب زي ايه كمان؟ الموبايل فون في الايمج ديتكشن او الايمج ريكوجنيشن، بعمل فيه unlock للفون او بعمل unlock للموبايل فون باستخدام الفينجر برينت. كل دول example ل weak artificial intelligence. Weak artificial intelligence perform specific tasks and are limited to those tasks only. طيب النوع الثاني هو strong AI أو artificial general intelligence. Strong AI are also known as general AI, refers to AI systems that possess human level intelligence or even surpass human intelligence across a wide range of tasks. Strong AI would be capable of understanding, reasoning, learning, and applying knowledge to solve complex problems in a manner similar to human cognition. في عندي كمان artificial super intelligence. artificial super intelligence far surpassing that of the brightest and most gifted human minds due to recursive self-improvement. Super intelligence is expected to be a rapid outcome of creating artificial general intelligence اللي هو ال strong AI. يبقى الكونكلوجن بتاعنا أنا عندي 3 أنواع من الماشين ليرنينج، من الارتفيشال انتليجنس. الاولاني artificial narrow intelligence وبقول عليه ماشين ليرنينج، وده بيبقى specialized in one area and solve one problem. في الماشين intelligence أو الارتفيشال general intelligence وده refer to a computer that is as smart as a human across the board. والنوع الثالث الارتفيشال سوبر انتليجنس اللي هو اللي بيبقى موجود في different field، في every field smarter than the human brain in every field. Most of the capabilities available today can be categorized as artificial narrow intelligence, which means it can assist with or take over specific focus tasks without the abilities to self-expand functionality. النوع الأولاني احنا قلنا اسمه Artificial Narrow Intelligence، وبنقول عليه Machine Learning. يعني ايه Machine Learning؟ يعني الماشين تقدر تتعلم. الماشين تقدر تتعلم في area to solve one problem. طيب، يعني ايه بالتفصيل machine learning؟ Machine learning is a type of artificial intelligence that allows a system to learn from data rather than through explicit programming. It involves the use of algorithms that can learn patterns and make prediction based on input data without being explicitly programmed to perform the task. الماشين ليرنينج بتشتغل ازاي؟ ماشين ليرنينج algorithm use statistical models to analyze and draw inferences from data. It helps you make predictions that minimize the errors that arise from merely guessing. يعني مش بنخمن، لا احنا بتقدر تعمل prediction، بتتنبأ. Application of machine learning technique find application across various domains, including image and speech recognition, natural language processing. For example, companies like Amazon use machine learning to recommend the products to a specific customer based on what they have looked at and bought before. يعني زي السجشن اللي بتطلع لنا على امازون او اي سايت، بيطلع لي سجشن، بيريكومند البرودكت بتاعته بناء على ايه؟ بناء على انا عملت اتفرجت على ايه واشتريت ايه قبل كده. ده اسمه نوع من انواع الماشين ليرنينج. في نوع تاني او سبست من الماشين ليرنينج اسمه ديب ليرنينج. Deep learning is a subset of machine learning that involves artificial neural networks to models and solve complex problems. It's inspired by the structure and function of the human brain, specifically the interconnected network of neurons. زي ما انتم شايفين كده، شبه الهيومن برين، الخلايا العصبية اللي في جسم الإنسان، عبارة عن شبكة من العقد المترابطة. Deep neural networks. Deep learning employs neural networks with multiple layers of interconnected nodes, enabling the learning of complex hierarchical representations of data. Deep learning algorithm have the ability to automatically extract relevant features from raw data, eliminating the need for explicit feature engineering. من application of deep learning computer vision. Deep learning has revolutionized computer vision tasks such as image recognition, object detection, image segmentation. كمان natural language processing. Deep learning techniques have been successfully applied to natural language processing tasks like sentiment analysis, language translation, and text generation. يقدر يعمل analysis للإحساس وترانسليت languages وtext generation. طيب كمان speech recognition. Deep learning models power speech recognition systems like virtual assistants and speech-to-text applications. الفرق بين الماشين ليرنينج والديب ليرنينج ان الديب ليرنينج عندها القدرة انها تعمل اوتوماتيك اكستراكت للريليفنت فيتشر فروم رو داتا بدون برمجة واضحة، عكس الماشين ليرنينج اللي لازم الاكسبرت تعمل selection for relevant features manually. والديب ليرنينج بتتكون عن طريق النيورال نتوركس. ال AI is the overarching system. Machine learning is a subset of AI. Deep learning is a subfield of machine learning, and neural networks make up the backbone of deep learning algorithms. ال AI, when a computer mimic human intelligence to perform a given task, زي medical diagnosis. Machine learning is a subset of AI that learns to perform a given task from data and improves with experience. Deep learning is a subset of machine learning that uses large neural networks and big data to better solve complex problems. يعني ايه بقى big data؟ البيج داتا اللي بيستخدمها الديب learning. Big data, the term big data is used in instance in which the data samples are too large to be adequately analyzed with traditional AI methods. In this case, new methods such as deep learning can be used. يبقى deep learning بيستخدم البيج داتا عشان يقدر يعمل analysis لعدد كبير من الداتا سامبلز علشان يقدر ياخد الديسيجنز الصح، او يقدر يبروسس، يعمل البروسيسنج بتاعه. الفرق بين الماشين ليرنينج والديب ليرنينج، الديب استأذنكم يا جماعة كده، تشيك كده ان الصوت اوكي شغال. لو حد يكتب لي في الشات الصوت شغال كده تمام. شغال تمام، اشكر حضراتكم، ميرسي. طيب احنا طب في حاجة مش واضحة لغاية لما اتكلمنا، احنا جاست قلنا يعني ايه كلمة artificial intelligence، وقلنا ان الماشين ليرنينج عبارة عن subset من الارتفيشال intelligence، والديب ليرنينج ده subset من الماشين ليرنينج. تمام لغاية كده تمام. هكمل انا بس بكمل الفرق بين الماشين ليرنينج والديب ليرنينج. الديب ليرنينج is an evolution of machine learning. Both deep learning and machine learning are algorithms that use data to learn, but the key difference is how they process and learn from the data. While basic machine learning models do become progressively better at performing their specific function as they take in new data, they still need some human interventions. لو ال AI algorithm returns an inaccurate prediction, then an engineer has to step in and make adjustments. إنما ال deep learning models, الالجوريزم can determine whether or not a prediction is accurate through its own neural network. Minimal to no human help is required. يعني ال deep learning model is able to learn through its own methods of computing، يعني techniques that make it seem like it has its own brain. طيب يبقى الماشين learning uses algorithms and learn on its own but may need human intervention to correct errors. إنما deep learning uses advanced computing, its own neural network to adapt with little to no human intervention. طيب احنا قلنا تاني ال AI is a broad field that encompasses deep learning and machine learning. Its goal is to develop smart tools that can carry out cognitive functions زي ايه؟ زي ال problem solving, ال sentiment analysis, ال decision making. الماشين ليرنينج بقى بتشتغل ازاي؟ بتريسيف الداتا، receive new information via a user query, analyze the data, find a pattern, make a prediction, and send an answer back to the user. في examples للماشين ليرنينج زي البروجرامز بتاعت الميوزك، زي اليوتيوب، زي الابل ميوزك، زي السبوتيفاي. بيعمل for a music service بيعمل recommendation لنيو songs او artists. الماشين ليرنينج algorithm associates the listeners preferences اللي هي السيفد سونج، البلاي ليست اللي هو عاملها، الفولو ذا ارتست اللي بيتابعهم، السونجز اللي عمل لها سكيب with other listener. بتاسوسييت listener preferences مع other listeners who have similar musical tastes، وبتشوفهم دوروا على ايه تاني وعجبهم، وبيبعت الريكومنديشن بناء على الاناليسز اللي بيعمله الماشين ليرنينج. طيب الديب ليرنينج ده عبارة عن سب فيلد من الماشين ليرنينج that structure create an artificial neural networks that can autonomously learn and make intelligent decisions. الالجوريزم بيريسيف الداتا، runs it through the input and hidden layers and generate deep learning. ايه الكمبيوتر فيجن؟ زي الكمبيوتر يبقى احنا قلنا ان الارتفيشال انتليجنس في سبسيت منه الماشين ليرنينج، وفي نوع من انواع الماشين ليرنينج اسمه الديب ليرنينج. طيب، وفي حاجة اسمها natural language processing. الناتشورال language processing ديت artificial intelligence is a branch of artificial intelligence focused on enabling computers to understand, interpret, and generate human language in a way that is both meaningful and useful. A natural language processing techniques involves processing and analyzing large volumes of text data to perform tasks such as text classification, sentiment analysis, translation, question answering, and text generation. من الابليكيشن of natural language processing الشاتبوت. Natural language processing is used to develop chatbot that can interact with users in natural language, providing information or assistance. دوت virtual assistants اللي بتكلمنا لما نيجي نسأل أي أسئلة زي سيري، زي شات جي بي تي، ده اسمه chatbot. بيتكلم معايا بالظبط كأنه إنسان بيرد عليا. يبقى الشات بوت ده application من natural language processing. كمان text summarization، يقدر يعمل لي summarization لتكست automatically generating summaries of long pieces of text. ويقدر يعمل من الابليكيشن speech recognition، يعني بيconvert ال spoken language into text. كمان في ال question answering system systems that can answer question posed in natural language. و information extraction بيextract relevant information من ال unstructured text data. يعني ايه unstructured text data؟ الأول يعني ايه ال structured data؟ structured data أي data أقدر أنظم follows a predefined format، أقدر أحطها في tables with rows and columns في databases. ودي سهل جدا إن يبقى في relation بين الداتا elements وبعضيها. هقدر أعمل لها analysis بطريقة سهلة، easy to be analyzed. example ليها الداتابيزز، السبريدشيتس، اي حاجه، اي انفورميشن اقدر احطها على اكسل شيت دي في روز وكولمز، دي اسمها structured data. طب ايه هي الانستراكتشرد داتا؟ الانستراكتشرد داتا حاجه كده ملهاش structure، او ما اقدرش انظمها بطريقه واضحه. زي ايه؟ او موجوده في various format زي text، images، audio، videos. اعمل لها اناليسز بطريقه سهله. هي صعب جدا ان انا اعمل لها اناليسز. فالتايب مثلا الايميلز، الارتكلز. يبقى ال organized data دي بنقول عليها structured data، وال unstructured data اللي هي unorganized data زي الايميلز، الارتكلز، الريبورتس، ايمج، الفيديوز، الاوديو فايل، اي سوشيال ميديا بوست. دول اسمهم unstructured data، والnatural language processing ممكن بطريقة أو relevant information. طيب الارتفيشال انتليجنس في الهيلث كير بيشتغل ازاي؟ عن طريق information sharing، هو اللي بيغذي الارتفيشال انتليجنس. يعني اي معلومه الانفورميشن شيرنج اللي بيغذي الارتفيشال انتليجنس عن طريق اي انفورميشن بتتنقل عن طريق النت، عن طريق evidence based guidelines، clinical protocols. الاطباء بيعملوا تشات بينهم وبين بعض، مناقشتهم عن اي حالة مرضية عن طريق الشات فويسز او الريتن شات، اي فيديو كونفرنس موجود، اي ايميل. كل ده بالاضافه للالكترونيك ميديكال ريكورد. كل المعلومات الكتير ديت اللي بالملايين، اللي بيتقال عليها بيج داتا، يعني large amount of data، بيتعمل لها processing واناليسيس عن طريق الارتفيشال انتليجنس ماشين اللي بتعمل prediction. يعني بناء على المعلومات المتاحة على الانترنت بيقدر الارتفيشال انتليجنس ماشين تتنبأ بمعلومات تقدر تطور الهيلث كير سيستم. artificial intelligence في الهيلث كير من اول 1980 كان بادي بقاعده كده اسمها if then rules. expert system based on collection of if then rules were the dominant technology for artificial intelligence in the من اول 1980 were widely used commercially in that and later period. في الهيلث كير they were widely employed for clinical decision support purposes over the last couple of decades and are still in wide use today. زي ايه؟ الالكترونيك هيلث ريكوردز اللي بتدينا معلومات كبيرة بناء على قاعدة set of rules، عبارة عن مجموعة من الرولز with their system. expert system if then rule require human experts and knowledge engineers to construct a series of rules in a particular knowledge domain. They work well up to a point and are easy to understand. However, when the number of rules is large, usually over several thousand, and the rules begin to conflict with each other, they tend to break down. يعني احنا دلوقتي هو قاعدة عملوا ماشين بإف then، حطوا لها قواعد لما يحصل كذا هيبقى التصرف عبارة عن كذا. بس لما القواعد ديت الرولز ديت بتبقى كتير، صعب ان انا اعمل لها بروجرامينج. moreover if the knowledge domain changing الرولز دي can be difficult and time consuming. They are slowly being replaced in healthcare by more approach based on data and machine learning algorithms. وظهر بالارتفيشال انتليجنس في الهيلث كير اللي اعتمد على الديجيتاليزيشن بتاع الميديكال ريكورد and the development of expert systems that could assist in diagnostic processes. The combination of advanced algorithms will increase the computing power will availability of vast healthcare data opened up new horizon. Will AI become a game changer in healthcare? والاي طبعا في الببليك هيلث ابتدى by offering innovative solution for disease prevention, surveillance, diagnosis, treatment, and health promotion. The creation and availability of novel streams of data relevant for health has increased في the last 20 years, providing detailed insight into social, behavioral, and environmental determinant of health. How AI is being utilized في public health. ال AI في public health نقدر نتكلم عنه إنه دخل في 7 دومين. أول حاجة فيهم disease surveillance and early warning system. في predictive analytics for disease risk assessment, precision public health, diagnostic support with decision making في drug discovery and development في health behavior analysis and interventions في public health workforce support في disease surveillance and early warning systems. ال AI algorithm can analyze vast amount of data from various sources such as social media, internet search, electronic health records, environmental sensors to detect disease outbreaks and monitor public health trends in real time. This enables early detection of infectious diseases, allowing public health authorities to implement timely intervention and prevent the spread of diseases. Public health surveillance is traditionally performed using population health survey. الطبيعي ان احنا كنا بنعمل الهيلث سيرفي، بجمع clinical data and public health reporting system. Access to new data sources and artificial intelligence methods provide opportunities to identify emerging health threats and develop a more detailed understanding of population disease and risk factor distributions, often with improved geographic resolution. ال AI models ممكن يستخدم الماشين learning technique to forecast the spread of infectious diseases based on historical data and real-time inputs. These models can predict the trajectory of outbreaks, estimate the risk of transmission in different regions, and inform resource allocation and intervention strategies. AI-powered systems monitor social media platforms for signals of disease outbreaks. يعني يقدر يعمل analysis للداتا اللي موجودة في السوشيال ميديا بلاتفورمز زي ما قلنا عن طريق ايه الناتشورال لانجويج بروسيسنج اللي يقدر يعمل analysis ل unstructured data. بيبص على المنشنز of symptoms للإلنس clusters ويعمل لها analysis بيanalyze the text data to identify relevant information and assess the potential impact of public health. كمان ال AI algorithm يقدر يعمل analysis لل syndromic surveillance data from various sources such as emergency department visits, الفارماسي sales، علشان يقدر يعمل detection ال AI algorithm كمان أو ال AI driven analysis of satellite imagery and remote sensing data can detect environmental factors associated with disease transmissions زي ال change في ال temperature، في ال humidity. الاسبكت التاني او الابلكيشنز التانية للاي اي في البابليك هيلث في البريدكتيف اناليتكس ديزيز ريسك اسسمنت. الاي اي powered predictive analytics can identify individuals or communities at higher risk of developing certain diseases based on demographic, clinical, and environmental factors. By predicting disease risk, public health officials can target interventions and resources more effectively to prevent disease and promote health in high-risk population. زي مثلا ال AI algorithms في ال predictive analytics disease for disease risk assessment. ال AI algorithm زي الماشين ليرنينج والديب ليرنينج مودلز يقدر يعمل analysis للارج داتا سيت containing demographic data, clinical data, genetic data, environmental and behavioral factors to predict individuals' risk of developing specific diseases. These models can identify high-risk individuals who may benefit from targeted intervention or preventive measures. AI-driven predictive analytics enable healthcare provider and public health agency to identify populations at elevated risk of certain diseases or health conditions by segmenting populations based on risk profiles. Interventions can be tailored to address specific needs and prioritize resources for individuals and communities most in need. كمان من ال AI application في ال public health ال precision public health. ال AI enables the analysis of large data set to identify patterns and association between genetic, environmental, and lifestyle factors and health outcomes. طب الانفورميشن ديت can be used to develop targeted interventions. يعني اقدر استخدم الانفورميشنز اللي انا جمعتها والباترنز والاسوسيشنز ديت ان انا اعمل targeted interventions و personalized health strategies tailored، بتبقى متفصلة to individual or population specific needs, ultimately improving health outcomes and reducing disparities. زي ان في AI driven predictive models يقدر يجنريت ال personalized risk assessment and recommendations for disease prevention, diagnosis والtreatment by analyzing ال individual level data زي ال genetic information, ال biomarkers, ال lifestyle factors. ال AI يقدر يتيلر intervention، يعني يفصل interventions لكل persons على حسب اليونيك characteristics بتاعته والpreferences بتاعته والneeds leading to more effective and targeted healthcare interventions. كمان نقدر نستخدمه في الدياجنوستيك support و decision making. ال AI driven diagnostic tools زي الماشين learning والimage recognition software can assist healthcare providers in diagnosing diseases more accurately and efficiently. التولز ديت تقدر can analyze medical images والlaboratory results والpatient data to aid in the diagnosis of conditions ranging from infectious diseases to chronic illnesses, improving patient outcomes وreducing diagnostic errors. ممكن تستخدم زي مثلا ال AI algorithm يقدر يعمل analysis للميديكال imaging data زي الاكس راي، زي الام ار اي سكان، زي السيتي سكانز to assist healthcare providers in diagnosing diseases and medical conditions. ال deep learning models يقدر يديتكت ال abnormalities والlesions والpatterns اللي موجودة وبتاعت various diseases, enabling earlier and more accurate diagnosis. كمان ممكن استخدمها في ال clinical decision support system. بيبروفايد ال healthcare providers ب recommendation بناء على ال guidelines وال evidence based guidelines علشان يعمل support لل clinical decision making. كمان بتستخدم في اللابوراتوري بالتست ريزلتس، يقدر ينتربريت التست ريزلتس زي البلاد تيست واليورين تيست والباثولوجي ريبورتس علشان يساعد في الديزيز دايجنوزس. من الابليكيشنز كمان اوف اي اي في الببليك هيلث الدراج ديسكفري اند ديفلوبمنت. ال AI accelerates the drug discovery and development processes by analyzing the biological data, identifying the potential drug targets, and predicting the efficacy and safety of new compounds. ال development of new drug دي بتبقى process طويلة جدا و very complicated. ممكن علشان يطلع new drug للماركت ممكن ياخد في حدود 12 سنة، ده بالطريقة التراديشنال. لما جه ال AI قدر إن هو artificial intelligence يساعد ويسرع في عملية الابروفل بتاعة الدواء. ازاي؟ زي ما حصل اكزامبل ان هو عمل ريبوربسنج للدراجز اللي اوريدي كانت موجوده ايام الكوفيد 19. كان قال ان في دراجز ممكن استخدمها اوريدي موجوده وممكن استخدمها للكوفيد 19. ده كان عن طريق الارتفيشال انتليجنس. كمان يقدر يسرع، يخلي ان انا اعمل ديفلوبمنت وابروفل للنيو دراجز بطريقه اسرع، ممكن تاخد في حدود السنه مثلا. ازاي؟ ان هو الاي اي الجوريزم بيانالارج لارج سكيل من البيولوجيكال والكيميكال داتا سيتس to identify existing drugs that may be repurposed for new therapeutic indications. كمان يقدر يعمل virtual screening، يعني ال AI driven virtual screening platforms use machine learning وال computational modeling technique to predict the binding affinity of small molecules to target البروتين. كمان يستخدم ال AI في ال public health في ال health behavior analysis and intervention. ال AI powered system can analyze the social media data, wearable device data, و other digital sources to understand health behaviors and trend in population. يبقى بيستخدم الداتا اللي في السوشيال ميديا والويربل ديفايس والديجيتال سورس، وبيعمل لهم اناليسيس، والانفورميشن دي can inform the development of targeted health promotion campaigns او behavioral change interventions او personalized health recommendation. كل ده to encourage healthier lifestyle and prevent طبعا ال chronic disease. بنتكلم عن الابليكيشن of artificial intelligence في البابليك هيلث. اتكلمنا عن disease surveillance و early warning systems، على predictive analytics for disease risk assessment، عن precision public health في الابليكيشن في diagnostic support و decision making، في drug discovery and development، وفي health behavioral analysis. ال AI powered system قلنا انه يقدر يعمل analysis للسوشيال ميديا داتا والwearable device داتا والother digital source to understand the health behavior and trends في population. زي قلنا ال AI driven predictive models يقدر يستخدم الماشين learning technique to forecast individuals' health behaviors based on historical data and contextual factors المودلز دي تقدر تبريدكت، تتنبأ بالبيهيفيرال behaviors بتاعة ال individuals such as ال physical activity level, ال dietary habits, ال smoking cessation, ال medication adherence, ال preventive healthcare utilization. ويعني بالبريدكشنز ديت هقدر اوجه الانترفنشنز بتاعتي to promote healthier behavior. في البابليك health workforce support، ال AI can assist public health professionals in managing and analyzing data, automating administrative tasks, and optimizing resource allocation. ازاي؟ على مثلا على الانديفيدوال، في مثلا فيرتشوال اسيستنتس زي زي ما قلنا، زي سيري، زي اليكسا، زي شات جي بي تي، جوجل ناو. دول اكزامبل لفيرتشوال اسيستنتس. دول عباره عن كمبيوتر بروجرامز كان بيرفورم التاسك، زي ان هم يحجزوا appointments, providing information about medical conditions, and even giving reminders about taking medications. الشات بوت ديت او الفيرتشوال اسيستنتس بتساعد can provide the patient with convenient access to information and care with fewer in-person visits. هتقلل الفيزيتس لما يقدر يحجز بالتليفون او عن طريق الفيرتشوال اسيستنت. الكمبيوتر الفيرتشوال اسيستنت اكيد هتقلل الفيزيتس بتاعته، سيف تايم وتسيف ماني، سواء للبيشنت والهيلث كير بروفايدرز. AI algorithm يقدر يanalyze vast amount of public health data including epidemiological data, surveillance data, electronic health record, and environmental data to generate actionable insights and inform decision making by automating data analysis tasks. ال AI enable ال healthcare professional to identify trends والpatterns emerging health threats more efficiently. يبقى how AI is being utilized في ال public health. اتكلمنا عن applications لل AI في ال disease surveillance وال early warning system، في ال predictive analytics وال disease risk assessment، في ال precision public health diagnostic support and decision making، ال drug discovery and development، في ال health behavior analysis and intervention، و public health workforce support. Overall, ال AI holds great promise for transforming public health by providing innovative solutions to complex health challenges, improving disease surveillance with diagnosis, with treatment, and advancing efforts to promote health and prevent disease in populations around the world. Thank you. ولو في أي حاجة ما كانتش واضحة أستأذن حضراتكم ابعتوا لي في الشات. ناخد دقيقة بريك ونبتدي إن شاء الله السيشن اللي بعديها. أشكر حضراتكم. Thank you. مساء الخير. لسه مع حضراتكم دكتورة ماري حبيب، ماجستير إدارة جودة الرعاية الصحية من المعهد العالي للصحة العامة جامعة اسكندرية. هنكمل مع بعض السيشن التانية عن ال Artificial Intelligence Application في ال Disease Surveillance وال Outbreak Detection. احنا اتكلمنا في السيشن اللي فاتت يعني ايه public health، يعني ايه artificial intelligence، والابليكيشنز اللي ممكن تستخدم في الارتفيشال انتليجنس في البابليك هيلث. هنتكلم دلوقتي عن الديزيز سيرفيلانس والاوتبريك ديتكشن، الارتفيشال انتليجنس ابليكيشنز اللي ممكن نستخدمها في السيرفيلانس والاوتبريك ديتكشن. الأول يعني إيه disease surveillance؟ ال disease surveillance involves systematic collection, analysis, interpretation, and dissemination of data related to occurrence and spread of diseases. Effective surveillance helps public health authorities detect and respond to health threats promptly. الانفكشوس ديزيز سيرفيلانس طبعا important epidemiological tool علشان نعمل مونيتورنج للهيلث اوف population. ايه هي الجولز بتاعه الانفكشوس ديزيز سيرفيلانس؟ الجول of infectious disease surveillance are to describe the current burden and epidemiology of disease. First, describing the burden and epidemiology, including seasonality, age distribution, age group of disease, in critical for demonstrating a need for interventions. يعني أنا بوصف current burden بتاع الديزيز ليه؟ علشان اقدر احدد الانترفنشن اللي انا هحتاجها. زي ايه الانترفنشن؟ ممكن تكون فاكسينيشن، ممكن تكون ماس دراج ادمنستريشن. السيرفيلانس كمان is also used to detect antimicrobial resistance in certain pathogens and the circulating strain of disease which help target vaccine intervention. زي مثلا example الانيوال انفلونزا الفاكسين كومبوزيشن. بعرف الكومبوزيشن بتاعت الفاكسين بتاع كل سنه. فاكسين الانفلونزا بناء على ايه؟ بناء على اناليسز ايه الانفلونزا اللي موجوده، السترينز بتاعت الانفلونزا اللي موجوده في السيزون دوت. Second, to monitor trends. بعمل monitor للtrends، monitor disease trend. زي ايه؟ such as the impact of interventions like vaccinations. Disease trends do not only mean the number of cases, but also the etiology of cases. Information garnered from vaccine effectiveness studies can be coupled with burden and cost information to describe the cost effectiveness بتاع الانترفنشن. السيرفيلانس كمان بيمونيتور الديزيز كنترول والديزيز elimination والديزيز eradication. الديزيز كنترول بيريفير to reducing the incidence of disease to a desired level and includes diseases زي الملاريا. الديزيز elimination اللي هو defined as zero disease in a defined geographic areas as a result of control measures. عملت control measures ووصلت ل zero disease، ده اسمه disease elimination. قولوا. يبقى احنا الجول بتاعت الانفكشوس ديزيز سيرفيلانس are to describe the current burden and etiology of disease, to monitor trends, and to identify outbreak when new pathogen. يبقى انا بعد ما عملت مونيتورنج كمان للترندز اقدر فاينلي اعمل ايدنتيفيكيشن للاوتبريكس والنيو باثوجين. الاونجوينج سيرفيلانس بتاع اي outbreak and epidemic prone disease can facilitate early detection of an outbreak, allowing a more rapid response. زي الابيديميك meningococcal disease في المننجيتال belt in Africa requires ongoing surveillance to identify the outbreak in the regions. The cholera surveillance is maintained globally to detect the outbreaks and requires mandatory reporting لل WHO. يبقى الجولز بتاعت الانفكشوس ديزيز سيرفيلانس بديسكرايب الكارنت بيردن والاتيولوجي اوف ديزيز، مونيتور الترندز، وايدنتيفاي الاوت بريك والنيو باثوجنز. طب ايه هي السيرفيلانس تولز والريسورسز اللي بستخدمها؟ البوبوليشن سيرفي، زي بعمل multiple indicator cluster surveys، demographic health surveys including the health examination surveys، كمان disease registries، environmental sample taking. زي ايه environmental sample taking؟ زي باخد sample من الاير، من الووتر، من السويل. civil registration and vital statistics، public health laboratory system. objective of surveillance system، key objective بتاع surveillance is to provide information to guide intervention. Public health surveillance provides the scientific and factual database essential to inform decision making. أنا محتاجة إن الديسيجن يبقى متاخد بناء على information، فاسمها informed decision making and appropriate public health action. The key objective من surveillance is to provide information to guide intervention. Public health objectives and actions needed to make successful interventions determine the design and implementation of surveillance system. For example, if the objective is to prevent the spread of epidemic of acute infectious diseases زي SARS, managers need to intervene quickly to stop the spread of disease. Therefore, they need a surveillance system that provides rapid early warning information from clinics and laboratories. طبعا in contrast, chronic diseases will health related behavior change slowly. فالمانجر typically monitor the effect of programs to change risky behaviors such as tobacco smoking أو chronic diseases once per year. يعني علشان الريسبونس بتاعها بيبقى بطيء والاكشنز بتاعتها بتبقى ابطأ، فانا محتاجه اجمع الانفورميشنز على مدى فترات زمنيه اوسع. السيرفيلانس سيستم تو information collected information in use is a number of ways to evaluate the effectiveness of control and preventive health measures. اقدر الانفورميشن دي استخدمها ان انا اعمل مونيتورنج للتشينج في الانفكشوس ايجنتس، زي مثلا الترند في الديفلوبمنت اوف انتي مايكروبيال ريزيستنس. استخدمها في support health planning and allocation of appropriate resources with the healthcare system. اعمل identification للhigh risk population or area to target the intervention. Provide a valuable archive of disease activity for future reference. يبقى traditional strategies للdisease surveillance هم المانيوال reporting system. طيب الهيلث كير بروفايدر reporting establish manual reporting system where healthcare providers are required to report cases of specific diseases to public health authorities through traditional channels زي الفون، الفاكس، الاونلاين فورمز. ممكن يبقى في عندي laboratory reporting. implement المانيوال reporting of laboratory confirmed cases. لما يطلع في حالات confirmed في أي لاب لازم يبلغ ويعمل reporting. يبقى إيه هي من التراديشنال strategies للديزيز سيرفيلانس؟ أول حاجة كانت المانيوال reporting system. طيب تاني حاجة كمان هنتكلم عليها epidemiological survey. Conduct traditional epidemiological surveys and studies to gather information on disease patterns. Risk factors and transmission dynamics. Surveillance network and collaboration. Establish local and regional disease surveillance networks where healthcare facilities and public health agency collaborate to share information on disease trends. يبقى عندي زي اللوكال والريجنال نتورك، كمان يبقى عندي international collaboration. Engage in international collaboration for the exchange of information on global disease trends following established protocol and communication channels. كمان المانيوال data entry and analysis. الداتا انتري ممكن استخدم personnel للداتا entry. employ data entry personnel to manually enter information from paperwork into digital databases for analysis. Epidemiological analysis. Conduct manual epidemiological analysis to identify patterns, calculate incidence rate, and determine the spread of diseases. Regular reporting and updates. عندي periodic reporting. Establish regular reporting schedules for healthcare facilities to submit aggregated disease data to public health agencies. بعمل كمان public health officials manually update databases and surveillance system with the latest information on disease trends. Epidemiological investigations. Conduct a tracing team, deploy contact tracing team to identify and monitor individuals who may have been exposed to contagious diseases. واعمل field investigation. Conduct a field investigation and interview to gather information of the resource and mode of disease transmission during the outbreak. education and training. بعمل training programs للهيلث كير بروفيشنالز والابيديميولوجيست والسيرفيلانس officers to enhance their skills in data collection and analysis واعمل public awareness campaign. يبقى الطريقه التراديشنال اللي احنا بنستخدمها علشان نعمل disease surveillance، يبقى انا بعمل reporting system، manual reporting system للكيسز اي لاب يبقى عنده confirmed cases لازم يبلغ، بيعمل ريبورتنج. تاني حاجة الابيديميولوجيكال سيرفي، على طول بعمل ستاديز علشان اجمع الانفورميشن عن الديزيز باترنز. بعمل السيرفيلانس نتورك وكولابوريشن عن طريق ان انا بعمل شيرنج انفورميشن عن on disease trends، واعمل اكتشينج للانفورميشن انترناشونالي، يعني على مستوى العالم كله بشير الديزيز ترندز. بعمل كمان المانيوال داتا انتري اند اناليسيس، بعين بيرسونال يدخلوا لي داتا والانفورميشن مانيوالي، ومن البيبر فورمز للديجيتال داتابيزز علشان اقدر اعمل لها اناليسيس، واعمل الابيديميولوجيكال اناليسيس وايدنتيفاي الباترن وكالكوليت الانسيدنس ريت وديترماين السبريد اوف ديزيزز. كمان يبقى عندي regular reportings وابديت. الريجولر ريبورتنج بعمل سبميت للاجريجيتد ديزيز داتا لبابليك هيلث ايجنسيز، وبعمل ابديت للداتابيزز ديت والسيرفيلانس سيستم. الابيديميولوجيكال انفستيجيشن بمونيتور الانديفيدوالز who may have been exposed للديزيز ديت، وبعمل انترفيو علشان اجمع information on the source والمود of disease transmission and duration in disease transmission في الاوتبريك. و education وtraining، اقدر اعمل training programs to enhance السكيلز في للناس اللي بتجمع الداتا كولكشن. وكمان بعمل public awareness campaigns علشان educate البابليك ايه هي اهميه الريبورتنج سيستم and seeking medical attention. طيب الارتفيشال انتليجنس سوليوشن في الديزيز سيرفيلانس. الارتفيشال انتليجنس offer advanced and efficient solution for disease surveillance and monitoring, providing capabilities that can enhance early detection, data analysis, and response strategies. يبقى لما دخل ال AI يقدر يساعدني في ايه؟ احنا قلنا traditional way للsurveillance of diseases. طب ال AI هيقدر يساعدني في ايه؟ هيقدر يدخل في ايه؟ هيقدر يساعدني ينهانس ال early detection والداتا analysis والresponse strategies. ازاي؟ عن طريق 8 application: predictive analytics, data analysis and pattern recognition, natural language processing, image والsensor data analysis, geospatial analysis والcontact tracing and surveillance, genomic surveillance والremote monitoring and telemedicine. طيب البريدكتيف اناليتكس ناخد واحده واحده. البريدكتيف اناليتكس دي branch of advanced analytics that uses both new and historical data to forecast future activities, behavior, and trends. Predictive analytics دي involves applying statistical analysis technique and automated machine learning algorithm to data sets to create predictive models. يعني هقدر اكرييت مودلز تقدر تتنبأ بالنمبرز بالفاليوز بالسكور عن اللايكليود of a particular event happening. Predictive analytics can be a powerful tool for identifying and responding to potential outbreaks of infectious diseases. ازاي؟ انه بيعمل analysis للداتا on past outbreaks as well as current data on factors زي ال weathers patterns، زي ال travel patterns، زي ال population movement. ال public health officials can use ال predictive analytics to forecast where and when an outbreak is most likely to occur. طبعا ده هيساعدني في ايه؟ ان انا هقدر اعمل allocation للريسورسز بتاعتي بطريقه more effective، واعمل target intervention بطريقه precise and communicate more effectively with the public about the risk associated with particular diseases. ايه هي الكي ways in which predictive analytics can be used in disease surveillance؟ أول حاجة predicting outbreaks، يقدر يتنبأ بالoutbreak نفسها. Predictive analytics can be used to predict the likelihood of an outbreak occurring in a particular location based on a range of factors زي ايه؟ weather patterns، travel patterns، population movement، حركة الناس. For example, by analyzing historical data on the relationship between temperature and spread of mosquito-borne diseases زي الزيكا أو الدنج fever, public health officials can use predictive models to forecast where and when an outbreak is most likely to occur. كمان أقدر أستخدمها في identify high risk population. Predictive analytics can also be used to identify populations that are at high risk of contracting a particular disease. إزاي؟ بيعمل analysis للداتا on factors زي age، gender، underlying health conditions، socio-economic status. Public health officials can use the predictive models to identify the populations that are most vulnerable to infection. هقدر أعرف البوبوليشن أكتر population تقدر تتعرض للإنفكشن، وبالتالي أقدر أعمل تارجت للانترفنشنز بتاعتي. الانترفنشنز بتاعتي هتبقى تارجتد، وابقى متأكدة إن الريسورسز بتاعتي are allocated بطريقة effective. Monitoring disease spread. Predictive analytics can also be used to monitor the spread of a disease. لما الاوتبريك تبقى already occurred، ازاي؟ انه بيعمل analysis للداتا on the number of cases in different location over time. Public health officials can use predictive models to forecast how the disease is likely to spread. ويقدر يستخدم الداتا ديت وانها تساعدني ان انا اقدر اعمل allocation للريسورسز بطريقه effective، والانترفنشنز بتاعتي تبقى مظبوطه in order to contain الاوتبريك. والابليكيشنز اقدر استخدم كمان البريدكتيف اناليتيك في ايه؟ في evaluating الانترفنشن. لما اوريدي عملت الانترفنشن، البريدكتيف اناليتيك اقدر استخدمه ان يقدر يعمل لي ايفالويشن للeffectiveness of different intervention in controlling the spread of disease by analyzing the data على number of cases reported before and after an intervention. يبقى انا بقيم الانترفنشن ان انا اشوف النمبر اوف كيسز قبل الانترفنشن ديت وبعد الانترفنشن ديت. هقدر اعمل بريدكشن للموديل للانترفنشن ديت عملت افكت ولا لا. فبالتالي it can help to identify interventions that are most effective in controlling the spread of a disease. The key ways in which predictive analytics can be used in disease surveillance and monitoring في predicting outbreak, identifying a high risk population, monitor a disease spread, evaluating interventions. في example how predictive analytics is being used في disease surveillance. مثلا عندنا السنتر اوف ديزيز اللي هو CDC Center for Disease Control and Prevention في اليونايتد ستيتس، بيستخدم البريدكتيف اناليتكس to forecast a seasonal influenza outbreak by analyzing the data on flu-related hospitalization والاوتبيشنت فيزيت واللابوراتوري تيستينج، يقدر السي دي سي يتنبأ to predict او to forecast where and when الفلو activity is likely to peak each season، وبالتالي يقدر يجهز يعمل allocation للريسورسز في الاماكن اللي عامل لها prediction ان ممكن يحصل فيها الاكتيفيتي اعلى من الاماكن التانية، فبيالوكيت الريسورسز. كمان نقدر الاي اي سيستم يقدر يبريدكت زي ما حصل في الكوفيد 19، يبريدكت الاوت بريك ويعمل لها ايرلي وورنينج والالرت. زي ايه؟ زي الكنديان بيزد اي اي موديل اللي اسمه بلو دوت. ده عمل بريدكشن للاوت بريك اوف انفكشن ات ذا اند اوف من 2019 في ديسمبر بالظبط، في 31 ديسمبر 2019 عمل وورنينج للكلاينت ان هيبقى فيه اوت بريك عن الكوفيد 19. وكمان في اي اي بيز مود نيمد الهيلث ماب، ده كان موجود في بوسطن تشيلدرن هوسبيتال في اليونايتد ستيت يوم 30 ديسمبر 2019. برضه بعت اليرت لليوزرز بتاعته ان هيبقى فيه اوت بريك. فالكوفيد 19 بانديميك اتبعت ان اوريدي كان في بريك. كمان الارتفيشال انتليجنس تول developed by researcher at University of Oxford وهارفارد ميديكال سكول عملوا اي اي تول يقدر يبريدكت النيو فيرال فاريانت بيفور زي ايمرج، يعني يقدر يشوف كمان المتحورات، يبريدكت المتحورات اللي طالعه من الكوفيد 19، وبالتالي هقدر اعمل الافكتيف انترفنشنز بتاعتي. كمان في الداتا اناليسز اند باترن ريكوجنيشن، الاي اي سيستم الاي اي اقدر استخدمه في الداتا اناليسز والباترن ريكوجنيشن. ازاي؟ الداتا analysis in disease surveillance involves the examination of various types of health data such as demographic information, clinical records, laboratory results, and environmental factors. ازاي؟ By analyzing this data set, public health authorities can identify patterns, correlations, and anomalies that may indicate the presence of a disease outbreak or a public health threat. طب ايه هو الرول بتاع الباترن ريكوجنيشن في الديزيز مونيتورنج؟ الباترن ريكوجنيشن تكنيك are essential to انه بيعمل detecting للسبتل patterns او trends within complex data sets that may not be immediately apparent to human analysis. يعني الانسان ما يقدرش يعمل اناليسس لكل الداتا ديت والباترنز والترندز ديت، انما طبعا الاي اي يقدر يتعامل معاها ويعمل لها اناليسس بسهوله. زي الماشين ليرنينج الجوريزم، الكلاسترنج كلاسيفيكيشن، بيعمل كلاسترنج كلاسيفيكيشن، يقدر يعمل انومالي ديتكشن لاي ديفكت. كل ده can help انه automate the process of identifying the unusual pattern والdeviation من normal health trends. طب ايه هي application of data analysis and pattern recognition in disease surveillance؟ في anomaly detection، يعني ال AI system يقدر identify ال abnormal patterns في ال health data signaling potential outbreak أو deviation من النورمال، يبقى يقدر يعمل لي detection لأي حاجة abnormal. كمان الريل تايم داتا اناليسيس، يقدر الاي اي ينيبل الريل تايم اناليسيس of vast amount of data sets، يعني large amount of data set including electronic health record. ليه؟ علشان to quickly identify the trends and pattern associated with any specific disease. طب كمان في الريسورس allocation الداتا analysis can assist in optimizing the resource allocation by identifying the high risk area or population that require targeted intervention. The pattern recognition technique can help prioritize the resource based on identified patterns or cluster of disease cases. يبقى أنا بعمل الداتا analysis والباترن recognitions. الهدف بتاعي إيه؟ علشان في الآخر أعمل allocation صح للريسورسز. يبقى الابلكيشن اوف داتا اناليسيز والباترن ريكوجنيشن في الديزيز سيرفيلانس بستخدمها في الانومالي ديتكشن، الريل تايم داتا اناليسيز والريسورس allocation. الناتشورال language processing. Natural language processing plays a crucial role in disease surveillance and monitoring by leveraging computational technique to extract, analyze, and interpret information from unstructured text data. وقلنا ايه الفرق بين الستراكشر داتا والانستراكشر داتا. الستراكشر داتا اي داتا اقدر انظمها في تيبلز، احطها في روز وكولمز، هي ستراكشر داتا. انما الانستراكشر داتا قلنا زي الايمج، الفيديوز، الاوديو فايل، السوشيال ميديا بوستس، الايميلز، الارتكلز، الريبورتس، التكستوال كونتنت، كل دول اسمهم unstructured data. بستخدم في الهيلث كير والابيديميولوجي الناتشورال لانجويج بروسيسنج ان انا اقدر اعمل اناليسيس لفاست اماونت اوف تكستوال داتا from sources زي الالكترونيك ميديكال ريكوردز اللي هو عباره عن ميديكال نوتس، كله نوتس كتاب. فالنوتس والريبورتس ديت هعمل لها اناليسيس ازاي من غير الناتشورال لانجويج بروسيسنج؟ كمان بعمل اناليسيس للسوشيال ميديا بوست، اي بوست موجود على السوشيال ميديا سواء كان فيديو سواء كان ايمج، النيوز ارتكلز بعمل لها برضه بيتعمل لها اناليسيس، والبابليك هيلث ريبورت كل دول بيتعمل لهم اناليسيس عن طريق الناتشورال لانجويج بروسيسنج تو ايدنتيفاي الترندز وديتكت الاوتبريكس ومونيتور الديزيز spreads and facilitate timely responses to public health threats. طيب الابلكيشن بتاع الناتشورال لانجويج بروسيسنج في الديزيز سيرفيلانس early detection of disease outbreak. الناتشورال لانجويج بروسيسنج algorithm can scan السوشيال ميديا بوست زي ما قلنا، ويقدر يسكان النيوز ارتكلز والاونلاين فورم علشان يديتكت الايرلي ساينز اوف potential disease outbreak، ويعمل analyzing لللانجويج patterns والكي ووردز related to symptoms او related للديزيز نفسه. والناتشورال language processing can help public health authorities to identify emerging health threats before they escalate. كمان في الابيديميولوجيكال ريسيرش الناتشورال language processing بتقدر تانيبل الريسيرشر انهم يعملوا اكستراكت للفاليوبل انسايت من الميديكال ليتريتشرز والكلينيكال نوتس اللي موجوده في الالكترونيك ميديكال ريكورد، انه باي اوتوماتيكلي اكستراكتنج الانفورميشن عن الديزيز بريفالنس وعن الريسك فاكتورز والتريتمنت اوتكمز والكوموربيديتيز من لارج فوليوم اوف داتا. يقدر الناتشورال لانجويج بروسيسنج يأكسلريت البروسيس بتاع ان هو يطلع لي epidemiological studies وسيستماتيك ريفيوز. كمان يقدر يهلب النون انجلش speaking epidemiologists. ازاي؟ ان في applications بتريسيفد الاي اي ليها عندها الاي اي كابابيلتيز وخصوصا الناتشورال لانجويج بروسيسنج انه يقدر يترانسليت، زي مثلا ابلكيشن زي الشات جي بي تي تقدر تبروسيس الناتشورال لانجويج تكست وتقدر تبرفورم كومبلكس اناليسيز للتكست ديت وتترانسليت التكست للناس اللي اوريدي التكست لو هي معموله بالانجلش للناس اللي مش على درايه باللغه الانجلش تقدر تعمل لهم ترانسليشن وتقدر تعمل درافت للارتكلز بتاعتهم وترانسليت ارتكلز باي لغه عن طريق الناتشورال لانجويج بروسيسنج. السيرفيلانس اوف انفكشوس ديزيز. من الابليكيشن اللي بتستخدم في الديزيز سيرفيلانس بمساعدة الناتشورال لانجويج بروسيسنج، قلنا الايرلي ديتكشن اوف ديزيز اوتبريك، الابيديميولوجيكال help non-English speaking epidemiologists, surveillance of infectious diseases. الابلكيشن بتاع الناتشورال لانجويج بروسيسنج في الديزيز سيرفيلانس كانت الايرلي ديتكشن اوف ديزيز اوتبريك، الابيديميولوجيكال ريسيرش، الهيلب نون انجلش سبيكينج ابيديميولوجيست، السيرفيلانس اوف انفكشوس ديزيزز، الفاكسين ادفيرس ايفنت مونيتورنج. وقلنا زي الفاكسين ادفيرس ايفنت مونيتورنج ازاي ان هو بيعمل اوتوماتيكالي اكستراكت للكاتيجورايزيشن بيقدر يعمل اكستراكشن ويقدر يعمل كاتيجورايزيشن للانفورميشن عن الفاكسين ريليتد سايد افكت، والديسكريبشنز اللي بتتكتب الريبورتس بتاعه السايد افكت. فبالتالي الناتشورال لانجويج بروسيسنج سيستم بيهلب الريجولاتوري ايجنسي ان هم يقيموا السيفتي بروفايل بتاع الفاكسين، وبالتالي ياخدوا الابروبريت اكشنز. كمان من الابليكيشنز بتاعت الاي اي في الديزيز سيرفيلانس، ايمج اند سنسور داتا اناليسيس. الاي اي باورد image and sensor data analysis have significantly improved disease surveillance by automating the detection of patterns and anomalies in medical images زي الاكس رايز، الام ار اي، السي تي سكان، الباثولوجي سلايدز. الماشين ليرنينج algorithm يقدر identify subtle change indicative of various diseases including infectious diseases زي بنتكلم عن الايمج and sensor data analysis. ال AI powered image and sensor data analysis يقدر الماشين change indicative of various الملاريا. الكابابيلتيز ديت allows for earlier diagnosis and treatment initiation leading to better patient outcomes. من الابليكيشن بتاعت الايمج and sensor data analysis precision medicine. AI driven insight from image and sensor data enable personalized treatment plans. يقدر يفصل البلانز tailored to individual patients according للunique characteristics بتاعت كل patient والdisease profile. كمان improved في public health policies. data driven decision making supported by AI analysis leads to evidence-based public health policies that prioritize the prevention and control measures effectively. كمان ال AI ممكن استخدمه في ال disease surveillance في ال geospatial analysis which is a powerful tool in disease surveillance and monitoring, enabling public health officials and researchers to identify patterns, track the spread of diseases, and inform policy decisions. With the advent of artificial intelligence, geospatial analysis has become even more advanced, allowing للdetection of subtle change في disease distribution وكمان في prediction بتاع disease outbreak. الابليكيشن بتاعت AI geospatial analysis في disease mapping and visualization. AI algorithm can analyze large data sets of disease incidents and create detailed maps that visualize the disease patterns and distribution. ده بيساعد ان انا اقدر اعمل identification للهوت سبوتس واقدر اعمل الانترفنشن بتاعتي تبقى targeted في السبيسيفيك geographical area. كمان travel pattern analysis. ال AI يقدر يعمل analysis يanalyze ال travel data to understand the movement of people and يقيم to assess the risk of disease transmission across different regions. الريسك assessment and prioritization. ال AI geospatial analysis يقدر يساعد في prioritization للresources والinterventions by assessing the risk of disease transmission in different geographical areas. This can be based on factors such as population density, access to healthcare, and environmental conditions. أقدر كمان بيساعدني كمان ال AI في ال evaluation of interventions and policies. ال AI can be used to evaluate the effectiveness of disease prevention and control measures زي ال vaccination campaigns, ال changes في ال public health policies. ده بيساعد في إن inform ال future policy decisions and improve the disease surveillance and monitoring. ال contact tracing and surveillance. ال AI contact tracing and surveillance have emerged a crucial tools in the fight against infectious diseases, particularly in the context of the ongoing COVID-19 pandemic. These technologies leverage artificial intelligence and data analytics to track the spread of diseases. We identify potential cases and support the public health interventions. زي الابليكيشنز of AI في الكونتاكت tracing والsurveillance. automated contact tracing. ال AI assists contact tracing applications identify and notify individuals who may have been exposed للinfectious diseases, facilitating rapid responses زي ما كان بيحصل في أثناء الكوفيد-19 pandemic. في ال behavioral analysis, ال AI can analyze the behavioral patterns and interactions to identify high risk individuals or groups for targeting interventions. وفي ال vaccination planning, ال AI contact tracing can help track the vaccine uptake and identify areas with low coverage, informing targeted vaccination campaigns and improving the overall population immunity. في genomic surveillance. Genomic surveillance refer to the systematic examinations of the genomes of pathogens to track their evolution and transmission and spread. يعني أنا بنعمل surveillance علشان نتراك الباثوجين، الايفوليوشن بتاع الباثوجين والترانسميشنز والسبريد بتاع الباثوجين دوت. الاي اي algorithm can analyze large genomic data set to identify patterns and trends that might be missed by human analysts. الجينوميك surveillance طبعا ده is very important in managing infectious diseases زي في الكوفيد 19 في الانفلونزا، في التوبركلوزس، في الاتش اي في. لو عملت مونيتورنج للجينيتكس تشينج في الباثوجنز، الساينتست كان تراك ذا emergence of new strains or variants. يقدروا كمان يعملوا مونيتورنج للدراج ريزيستنس، وبالتالي develop more effective vaccines and treatments. طيب ايه هي الاي اي ابلكيشن في الجينوميك سيرفيلانس؟ في السيكونس اناليسيس، الاي اي algorithm can analyze genomic data to understand the genetic makeup of pathogens, track mutations, and identify potential treatment strategies. الماشين learning technique can be used to classify a pathogen based on their genetic characteristics and predict their antimicrobial resistance profile. كمان في ال predictive modeling, ال AI algorithm can be used to predict the spread of disease based on genomic data. ال predictive models can help public health officials plan for future outbreak and allocate resources more effectively. في الداتا انتجريشن، ال AI algorithm can integrate ال genomic data with other type of data زي ال clinical data وال environmental data to provide a more comprehensive view of disease transmission dynamics. This information can be used to develop more targeted interventions and improve the overall public health outcomes. آخر حاجة الريموت مونيتورنج والتليميديسن. ال AI powered remote monitoring and telemedicine solution have shown promising results in improving the patient outcomes, reducing the healthcare cost, and promoting public health. في التيلي هيلث، التليميديسن شات بوت، زي ايه؟ ان الاي اي باورد شات بوت اللي هم الفيرتشوال اسيستنتس، وفي الريموت كونسلتيشن يقدر يدي كونسلتيشن، استشارات طبيه، symptoms assessment، وكمان guidance reducing the burden on healthcare system. في الريموت patient monitoring، ال AI enabled devices and platform monitor patients remotely, providing real-time health data and alerting healthcare provider to potential complications. ال AI devices can monitor ال vital signs زي ال heart rate، زي ال blood temperature، ال oxygen saturation in real time في نفس الوقت، providing insight into patients' health status. كمان ال wearable devices، ال AI enable wearables زي ال smart watch، ال fitness tracker collect and analyze data related to physical activities, sleep patterns, and other relevant health metrics. ال telemedicine consultation، ال AI chatbot and virtual assistants، ال AI driven chatbot and virtual assistant can conduct ال preliminary symptoms assessment. يعني لو أنا قلت للشات بوت السيستم السيمتومز اللي عندي، يقدر يعمل مبدئيا assessment مبدئي، ويأنسر ال patient queries and provide guidance. كمان ممكن يستخدم في التليميديسن كونسلتيشن، ممكن استخدم الناتشورال لانجويج بروسيسنج تكنولوجيز اللي بتساعد to interpret and analyze التكست او السبيتش داتا اثناء التليميديسن انتراكشن، aiding في الدياجنوزز اند تريتمنت بلاننج. كمان اقدر استخدم في الاي اي الجوريزم اللي بيأسست الهيلث كير بروفايدر انه يقدر يعمل انتربريتنج للميديكال ايمجز والdiagnostic test remotely, enhancing the accuracy of virtual consultation. يبقى احنا ال AI applications في الديزيز سيرفيلانس اللي اتكلمنا عنهم، اتكلمنا عن ال predictive analytics والdata analysis and pattern recognition، الناتشورال language processing، والايمج and sensor data analysis، الجيوسبيشال analysis، والcontact tracing and surveillance، genomic surveillance، remote monitoring and telemedicine. ال AI powered solution significantly طبعا enhance the speed والaccuracy والefficiency of disease surveillance and monitoring provide valuable tools للpublic health officials to proactively manage and respond للhealth threats. طبعا in conclusion ال AI can analyze large data set to identify a disease outbreak أو to track the spread of infectious diseases and to predict the future health trends. طبعا الانفورميشن دي تقدر تبقى very important في الببليك هيلث للببليك هيلث اوفيشالز علشان بتساعدهم انهم يعملوا preventions، يعملوا policies للpreventions وستراتيجيز انهم يعملوا كنترول للديزيزز والاوتبريكس دي. Thank you very much. في حاجة ما كانتش واضحة؟ لو في حاجة مش واضحة استأذنكم ممكن تكتبوا لي في الشات. شكرا جدا لحضراتكم، ونرجع كمان دقيقة السيشن اللي بعديها. شكرا جدا. Thank you very much. ستيل مع حضراتكم دكتورة ماري حبيب، ماجستير إدارة جودة الرعاية الصحية من المعهد العالي للصحة العامة جامعة اسكندرية. اتكلمنا في السيشن الأولى عن يعني اتكلمنا يعني ايه artificial intelligence، يعني ايه public health، ايه هي الابليكيشنز بتاعت ال AI health، واتكلمنا عن في السيشن اللي فاتت عن الديزيز سيرفيلانس والابليكيشن اوف AI في الديزيز سيرفيلانس. هنتكلم دلوقتي عن الابليكيشنز بتاعت ال AI في البريدكتيف اناليتكس فور بابليك هيلث. ال AI driven predictive analytics ال AI has been increasingly utilized in public health to enhance predictive analytics, which involve using data and algorithm to prevent encompass a wide range of applications aimed at improving disease control, screening, treatment policies, and preventing interventions. فكرة البريدكتيف اناليسيز عبارة عن عندي داتا، الداتا دي بيتعمل لها analysis what is happening now و why it is happened علشان اقدر predict، نعم يتعمل لها analysis و prediction ل what is going to happen in future. فبداية البريدكتيف analysis ان يبقى عندي data. طيب ايه هي الداتا sources؟ Artificial intelligence driven predictive analytics for public health relies on a wide range of data sources to generate insight and predictions. Data source طبعا provide valuable information about the health outcome, disease patterns, population demographics, environmental factors, social determinant of health. زي ايه بقى الداتا سورسز؟ عندي الالكترونيك هيلث ريكوردز. الالكترونيك هيلث ريكورد سيستم contain comprehensive data on patient medical history, on diagnosis, treatments, medications, laboratory test results, clinical encounters. Analyzing electronic health records data allows researchers and public health professionals to assess disease prevalence, treatment effectiveness, healthcare utilization patterns, population health trends. يبقى الالكترونيك هيلث ريكورد ده سورس مهم جدا للديتا. طيب بجيب الداتا بتاعتي منين؟ زي ما قلت من الكومبريهنسيف ريكوردز اوف بيشنت، من الميديكال ريكورد، الدايجنوزس، التريتمنت، الميديكيشن، الكلينيكال انكاونتر. بستخدمه في ابلكيشن زي ان انا اقدر اعمل بريدكشن للموديلنج بتاع الديزيز ريسك اسسمنت، او اقدر اعمل ايدنتيفاينج للهاي ريسك population فور تارجتد انترفنشن، او predict الهيلث كير يوتيلايزيشن باترن، او assessing التريتمنت اوتكمز. كل دوت من الالكترونيك هيلث ريكوردز. طيب الديزيز سيرفيلانس سيستم. الديزيز سيرفيلانس سيستم collect and monitor data on reportable diseases, infectious disease outbreak and other health related events زي ما قلنا. This system include surveillance networks that track diseases زي الانفلونزا، زي الكوفيد-19، الفود-borne illness. بيتعمل analyzing للديزيز surveillance data، وده طبعا بيساعد في البابليك هيلث ايجنسي ان هي تديتكت الاوتبريك، تعمل assessment للديزيز ترندز، تimplement الانترفنشن in time. بستخدم الداتا اللي تخص الديزيز سيرفيلانس سيستم في ايه؟ ممكن ان انا استخدمه في ابلكيشن زي الايرلي ديتكشن اوف ديزيز اوتبريك، مونيتورنج للديزيز ترندز، فوركاستنج الديزيز انسيدنس، انفورمينج البابليك هيلث انترفنشن. في السيندروميك ريليفانس داتا، السيندروميك ريليفانس داتا بيمونيتور الداتا from healthcare facilities, emergency departments and other sources to detect patterns of symptoms and syndrome indicative of potential disease outbreak. بستخدمها في applications threats زي monitoring للtrends في illness symptoms، زي supporting للrapid response effort during الاوتبريك. الهيلث كير كليم اند بيلينج داتا contain الفواتير والكليمز دي بتكونتين انفورميشن عن الهيلث كير سيرفيس، عن البروسيجرز، عن الميديكيشنز اللي اخدها، عن الدايجنوزس. كل دوت بهدف الريمبورسمنت باي هيلث كير بروفايدرز. Analyzing الكليم data enable researcher to assess health care utilization patterns والtreatment costs والdisease prevalence in population. واقدر استخدمه في application health care cost و identifying the opportunity for cost effective intervention. environmental data بتprovide information زي عن حاجات زي الاير كواليتي، عن الووتر كواليتي، عن الويذر باترنز، عن الكليمات كونديشن، الجيوغرافيك فاكتورز. كل دول بيعملوا influence على البابليك هيلث. الانفيرومنتال داتا بتinclude الميجرمنتس from air quality monitors, water quality sensors, weather stations, satellite imagery, geographic information system. بتانالايز لو عملت analysis للenvironmental data بتhelps to identify environmental health hazards ونعمل assessment للimpact on health outcomes and inform public health interventions. في applications زي ايه؟ زي ان انا بعمل assessing للenvironmental health risk, predicting a disease outbreak linked to environmental factors و-informing environmental health policies and interventions. A social determinant of health data encompass social, economic, and environmental factors that influence health outcomes and disparities. Social determinant of health data sources include census data, socio-economic indicator, housing information, educational attainment, employment status, and access to social determinant of health data helps the public health agency in here to understand the health inequities with target intervention to vulnerable populations and address underlying social determinant of health. بستخدمها في ايه؟ ان انا بعمل identification للhealth inequity, targeting intervention to vulnerable population, addressing social determinant of health, and promoting health equity. behavioral data sources capture information on health related behaviors زي lifestyle choices, risk factors للchronic diseases. Behavioral data include data from surveys, health assessment, wearable devices, mobile health application, social media platforms. Analyzing behavioral data helps public health researchers understand health behaviors, identify trends, we develop targeted intervention to promote healthier lifestyle and prevent disease. example للابليكيشن في البيهيفيرال داتا بستخدمها في الاي اي ان اعمل understanding للهيلث behavior, identifying the risk factors for chronic diseases, predicting health outcome. في الجينوميك and biomedical data الجينوميك والبيوميديكال data provide insight into genetic factors underlying health and disease. Genomic data include the DNA sequencing data, gene expression profile, genetic variation associated with biomedical data, assessment with precision health initiatives. كل الداتا سورسز ديت اللي هي الالكترونيك هيلث ريكورد، disease surveillance system، surveillance data، الهيلث كليم والبيلينج داتا والانفيرمنتال داتا والسوشيال داتا والجينوميك والبيوميديكال provide a rich and diverse array of information for AI-driven predictive analytics in public health. By integrating and analyzing, this can gain valuable insight into the factor influencing population health, enabling more effective decision making and targeted intervention to improve the health outcome. يبقى بناء على السورسز of data أو الداتا باخدها من المصادر بتاعتها تخص health. بقدر أعمل analysis، أقدر أعرف what is happening now and why it has happened علشان أقدر أعمل prediction what is going to happen in future. Using these data sources, AI driven predictive analytics holds significant promise for public health by leveraging advanced algorithms to forecast the disease trends. يقدر يpredict الديزيز ترند، identify ال at risk population، وبالتالي يقدر يinform ال targeted intervention. بنتكلم how ال AI driven predictive analytics can be applied in public health. أول حاجة هنتكلم عن ال disease surveillance وال outbreak prediction. ال AI algorithm can analyze diverse data sources, including electronic health records, social media, internet search, environmental sensors, and demographic information to detect patterns and trends indicative of disease outbreaks. By identifying the early warning signals, the public health authorities can implement proactive measures to contain outbreaks and mitigate their impact. AI-driven predictive analytics is being applied in various ways to enhance disease surveillance and outbreak prediction من applications بتاع السيرفيلانس، الديزيز سيرفيلانس والاوتبريك بريدكشن، early detection of infectious disease outbreaks, diverse data sources including social media posts, الانترنت search queries, النيوز reports infectious disease outbreak. For example, Google's flu trend flu activities في real time enabling disease surveillance والoutbreak prediction. السيندروميك surveillance. ال AI driven predictive analytics can monitor السيندروميك داتا زي الامرجنسي ديبارتمنت فيزيتس، زي الفارماسي سيلز، زي الاوتبيشنت فيزيتس to detect unusual patterns or clusters of symptoms indicative of disease outbreak. الفوركاستنج disease trends. ال AI model can analyze the historical data, demographic factors, environmental conditions, and other relevant variables to forecast the disease trend and predict future disease burden. Geospatial analysis. AI driven predictive analytics can perform geospatial analysis to identify spatial clusters or hot spots of disease activities ويعمل assessment للspatial patterns of disease transmissions. الريسك assessment and stratification. ال AI model can assess individuals or population level risk for specific diseases or من الابليكيشن بتاعت الديزيز سيرفيلانس واوتبريك ديتكشن، early detection infectious disease outbreak، السيندروميك سيرفيلانس، الفوركاستنج ديزيز ترند، الجيوسباشيال اناليسيز، الريسك اسسمنت اند stratification. بيعمل الاي اي موديل can assess the individuals or population level risk for specific disease او adverse health outcomes based on demographic وclinical environmental factors. الانفايرمنتال هيلث مونيتورنج، الاي اي الجوريزم يقدر يعمل اناليسز للانفايرمنتال داتا علشان to assess الانفايرمنتال هيلث ريسك and predict البوتنشال هيلث هازارد. والريل تايم اوتبريك ديتكشن اند ريسبونس، الاي اي دريفن بريدكتيف اناليتكس can enable real-time monitoring of disease outbreak and facilitate rapid response efforts. ده كان الابليكيشنز بتاعه البريدكتيف اناليتكس ديزيز سيرفيلانس اند اوتبريك ديتكشن. طيب في الريسك اسسمنت اند ستراتيفيكيشن، الاي اي موديل can analyze the large data set to assess individual or population level risk for specific health conditions such as infectious diseases, chronic diseases, or adverse health outcomes. This risk assessment can inform targeted interventions and preventive measures to reduce the disease burden and improve health outcomes in high-risk populations. ال AI-driven predictive analytics في public health plays an important role in risk assessment and stratification, enabling public health agencies to identify population at higher risk of specific health conditions and allocate resources effectively. من الابليكيشنز والاكزامبلز للchronic disease risk prediction، الكرونيك ديزيز ريسك بريدكشن. اول حاجه الاي اي الجوريزم يقدر يانالايز الالكترونيك هيلث ريكوردز، يانالايز الديموغرافيك داتا، اللايف ستايل فاكتورز والكلينيكال انديكيتورز to predict the risk of developing chronic diseases زي الديابيتس، الكارديوفاسكولار ديزيز او الكانسر. For example, predictive model can assess individuals' risk based on their likelihood of developing specific chronic conditions. In population health management, AI-driven predictive analytics is used to stratify populations based on their health status, healthcare utilization patterns, and social determinant of health. Public health agencies can identify vulnerable population at higher risk of poor health outcomes, such as low-income communities or individuals with limited access to healthcare, and develop targeted interventions to improve health outcomes and reduce disparities. Infectious disease outbreak prediction. The AI algorithm analyze diverse data sources, including disease surveillance data, environmental factors, the population mobility patterns, social media activity, to predict the risk of infectious disease outbreak. زي predictive models can forecast the spread of diseases like influenza or COVID-19 and identify high-risk areas for targeted interventions and public health measures. Environmental health risk assessment. AI-driven predictive analytics is used to assess environmental health risk and stratify population based on their exposure to environmental hazards such as air pollutions, water contamination, hazardous waste sites. For instance, predictive models can analyze environmental data and demographic factors to identify communities at higher risk of environmental health problems and prioritize intervention to mitigate risks. Emergency preparedness and response. AI-driven predictive analytics helps public health agencies prepare for and respond to public health emergencies such as natural disasters, disease outbreak, or bioterrorism event. Predictive models can assess the potential impact of emergency, predict healthcare resource needs, and prioritize response effort to minimize the impact on public health and safety. Health equity assessment. AI algorithm analyze social determinant of health, including socioeconomic status, race, education level, and access to health to assess health equity and identify disparities في health outcomes. Public health agency can use predictive analytics to stratify population based on their social determinants of health and develop targeted intervention to address health inequities and improve health outcomes for marginalized communities. يبقى examples AI driven predictive analytics في public health risk assessment and stratification, chronic disease risk prediction, population health management, infectious disease outbreak prediction, environmental health risk assessment, emergency preparedness and response, health equity assessment. طيب في health care resource allocation, predictive analytics can help optimize the allocation of healthcare resources, such as hospital beds, medical supplies, personnel, by forecasting demand based on projected disease trends and patient needs. By improving resource allocation efficiency, public health agencies can enhance their capacity to respond to public health emergencies and deliver
مساء الخير. نرجع تاني مع حضراتكم. كنا بنتكلم عن ال Predictive Analytics in Public Health. اتكلمنا عن ال Data Sources اللي هي من أهمها ال Electronic Health Records، ال Disease Surveillance Systems، Syndromic Surveillance Data، ال Healthcare Claims and Billing Data، وال Environmental Data، وال Social Determinant of Health Data، وال Behavioral Data، وال Genomic and Biomedical Data. وقلنا ان احنا بنستخدم السورسز اوف داتا ديت
مساء الخير. كنا بنتكلم عن ال predictive analytics and how AI-driven predictive analytics can be applied in public health. أول حاجة ال disease surveillance and outbreak prediction، واتكلمنا عن ال applications بتاعت ال disease surveillance و outbreak prediction زي ال early detection of the infectious disease outbreaks، زي ال syndromic surveillance، زي ال forecasting disease trends، ال geospatial analysis، ال risk assessment and stratification، environmental health monitoring، ال real time outbreak detection and response، وكمان في ال risk assessment and stratification. بستخدم ال AI model انه بيعمل في ال predictive analytics انه هو بيعمل analysis ل large data set to assess ال individual او ال population level risk for specific health conditions. وال AI applications بتاعتها زي ال chronic disease risk prediction، ال population health management، ال infectious disease outbreak prediction، ال environmental health risk assessment، ال emergency preparedness and response، والhealth equity. وكمان في ال healthcare resource allocation. ال predictive analytics can help optimize the allocation of healthcare resources such as hospital beds, medical supplies, and personnel by forecasting demand based on projected disease trends and patient needs. By improving resource allocation efficiency, public health agencies can enhance their capacity to respond to public health emergencies and deliver timely healthcare services. من ال AI applications في ال health resource allocation، ال demand forecasting for healthcare services. ال AI algorithm analyze historical healthcare data such as patient admission, such as emergency department visits and outpatient clinic utilization to forecast future demand for healthcare services. Also, bed management and capacity planning. AI-driven predictive analytics is used to optimize bed management and capacity planning in hospitals and healthcare facilities. Predictive models analyze patient flow, length of stay, and admission patterns to predict bed occupancy level and identify bottleneck in healthcare system. Resource allocation for public health emergencies. AI algorithm analyze data from disease surveillance systems, population demographics, and geographic information to predict the spread of infectious diseases and assess the healthcare resources needs during public health emergencies. Optimization of healthcare settings and optimization of healthcare staffing. AI-driven predictive analytic can help healthcare organization to optimize staffing levels and schedules to match patient demand and improve workforce efficiency. Predictive models analyze patient flow data, appointment schedules, and staffing patterns to predict staffing needs and optimize staffing assignments. For example, predictive analytics can help hospitals adjust the staffing levels based on anticipated patient volumes and acuity level, reducing overtime cost and improving staff satisfaction. Supply chain management. AI algorithm analyze supply chain data such as inventory levels, demand forecast, and supplier performance to optimize inventory management and procurement processes. Predictive analytics also can forecast the demand for medical supplies and pharmaceuticals and equipments, enabling healthcare organizations to maintain adequate stock levels and minimize the stock out or excess inventory. For example, predictive models can predict spikes in demand for specific medical supplies during public health emergencies and help healthcare providers procure and distribute supplies efficiently. In telemedicine resource allocation, AI can be used in telemedicine resource allocation. With the rise of telemedicine, AI-driven predictive analytics can optimize resource allocation for virtual care services. Predictive models analyze patient demographics, clinical outcomes, and appointment history to predict a demand for telemedicine appointments and allocate resources accordingly. For instance, predictive analytics can help telemedicine providers optimize appointment scheduling and staffing to meet patient demand and ensure timely access to virtual care services. AI-driven predictive analytics in public health and healthcare resource allocation involves leveraging advanced algorithms for forecasting demand for healthcare services, optimize resource allocation, and improve healthcare delivery through demand forecasting for healthcare services, bed management and capacity planning, resource allocation for public health emergency, optimization of healthcare staffing, supply chain management, and telemedicine resource allocation. Also, AI in predictive analysis can help in identifying social determinant of health. AI-driven predictive analytics can identify social determinant of health such as socioeconomic status, education level, housing conditions, and access to health care that influence health outcomes. By analyzing social and environmental data, public health officials can develop targeted intervention to address underlying social determinants and reduce health disparities in vulnerable communities. AI-driven predictive analytics in public health can play an important role in identifying social determinant of health, which are the social, economic, environmental factors that influence health outcomes. Some application and examples in identifying social determinant of health: population health risk assessment. AI algorithm can analyze various data sources, including electronic health records, demographic data, socioeconomic indicators, and environmental data to assess population health risk and identify communities at higher risk of poor health outcomes. For example, predictive models can analyze data to predict the prevalence of chronic diseases, such as diabetes, cardiovascular diseases, or obesity in specific geographic area. Health equity assessment. AI-driven predictive analytics helps assess health equity and identify disparities in health outcomes across different population groups. Predictive models can analyze social health determinant data to stratify population based on factors such as income, education level, race, and assess the healthcare accessibility. For example, predictive analytics can identify communities with higher rates of infant mortality, low birth weight, or preventable hospitalization, including disparities in health outcomes. Targeted interventions. AI-driven predictive analytics enable targeted interventions to address social determinant of health and improve health outcomes in vulnerable population. Public health agencies can use predictive models to identify communities at higher risk of health disparities and develop targeted intervention to address underlying social, economic, and environmental factors. For instance, predictive analytics can inform community health initiatives targeting food insecurity, housing instability, or access to healthcare services in underserved area. Public health policy development. AI-driven predictive analytics provide insight into the impact of social determinant of health on population health outcomes, informing the development of public health policies and interventions. Predictive models can analyze the social determinants data to identify policy priorities and evaluate the effectiveness of intervention aimed at addressing health disparities. For example, predictive analytics can assess the impact of housing policies, transportation initiatives, or income support program on health outcomes and inform policy decision. Healthcare resource allocation. AI-driven predictive analytics helps allocate healthcare resources effectively by considering social determinant of health in resource planning and allocation decisions. For example, predictive analytics can inform decision about the location of healthcare facilities, the allocation of healthcare providers, and the distribution of health services to address disparities in access to care. Community health needs assessment. AI algorithm analyzes social determinants data to conduct community health needs assessment and identify priority areas for public health interventions. Predictive models can analyze demographic data, health behaviors, environmental factors, and social determinant to assess community health needs and develop evidence-based strategies to improve health outcomes. For example, predictive analytics can identify communities with higher rate of food deserts, limited access to physical activity opportunities, or environmental pollution, informing communities' health planning efforts. يبقى دول الابليكيشنز واكزامبلز لل AI في identifying social determinant of health using predictive analytics. Behavioral analysis and intervention. AI models can analyze digital data such as social media activity, wearable device data, and mobile health app usage to understand the health-related behaviors and preferences. This information can be used to tailor health promotion campaigns, behavioral change, interventions, and personalized health recommendation to encourage healthier lifestyle and prevent chronic diseases. AI-driven predictive analytics in public health is increasingly utilized for behavioral analysis and intervention, enabling tailored approach to health promotion and disease prevention. Some examples and some application for predictive analytics using AI. Health behavior analysis. AI algorithm analyze digital data sources such as social media activity, mobile app usage, and wearable device data to understand the health-related behaviors and trends in population. For example, predictive analytics can identify patterns of physical activities, dietary habits, sleep patterns, and stress level based on data from fitness trackers or health application. Risk assessment and stratification. AI-driven predictive analytics assess individual or population-level risk for specific health behaviors or outcomes based on demographic, clinical, and behavioral factors. For instance, predictive models can identify individuals at higher risk of developing unhealthy behaviors, such as smoking, substance abuse, or sedentary lifestyle based on their socio-demographic characteristic and behavioral pattern. Health promotion campaigns. AI algorithm can inform the design and implementation of targeted health promotion campaigns and behavioral change interventions. Predictive analytics can identify audience with specific health-related interest or preferences and tailor messaging and interventions accordingly. For example, predictive models can analyze social media data to identify individuals interested in healthy eating and deliver targeted advertisement or educational content promoting nutritious diet. Personalized health recommendation. AI-driven predictive analytics enable personalized health recommendation tailored to individual preferences, behavior, and health goal. Predictive models can analyze user-generated data from health app, from wearable devices, online platform to provide personalized recommendation for physical activity, for nutrition, for stress management, and other health behaviors. Behavioral risk modification. AI-driven predictive analytics support interventions aimed at modifying health-related behaviors and reducing behavioral risk factors for chronic diseases. Predictive models can identify individuals at higher risk of unhealthy behaviors and deliver targeted interventions such as behavioral coaching, motivational messaging, gamified experiences to promote behavioral change. Social network analysis. AI algorithm can analyze social network data to understand social influences on health communities for targeted interventions. Predictive analytics can identify social networks or peer groups with similar health-related interest or behavioral and leverages social connections to promote positive health behaviors. For example, predictive models can analyze social media networks to identify influential health ambassadors who can disseminate health information and promote behavioral change within their social circle. All these examples demonstrate how AI-driven predictive analytics is revolutionizing behavioral analysis and intervention in public health by using digital data sources, advanced algorithms, and personal approach to promote health and prevent disease. Environmental health monitoring. AI algorithm can analyze environmental data such as air and water quality measurement, weather patterns, and geographic information to assess environmental health risk and predict potential health hazards, such as pollution-related illness or climate-related health impacts. By monitoring environmental factors, public health agencies can implement targeted intervention to protect public health and to prevent environmental health threats. Example of AI predictive application in environmental health monitoring, air quality monitoring and pollution prediction. AI algorithm analyze data from air quality sensors, satellite imagery, weather forecast, and geographic information system to monitor air pollution level and predict future pollution trends. Water quality surveillance. AI-driven predictive analytics assess water quality data from sources such as water treatment plants, rivers, lake, and groundwater wells to detect contamination events and assess water safety. Food safety monitoring. AI algorithm analyze food safety data, including foodborne illness reports, food inspection results, and supply chain data to monitor food safety risks and identify potential foodborne disease outbreaks. Climate change impact assessment. AI-driven predictive analytics assess the impact of climate change on public health by analyzing environmental data and climate models to predict future health risk. vector-borne disease surveillance. AI algorithm analyze environmental data such as temperature, humidity, and land use to predict the spatial and temporal distribution of vector-borne diseases such as malaria, dengue fever, and Lyme disease. Environmental health impact assessment, AI-driven predictive analytics assess the health impact of environmental exposure by analyzing data on pollutant levels, exposure pathways, and health outcomes. Disasters risk reduction. AI predictive analytics support disaster risk reduction efforts by assessing environmental hazards and predicting the likelihood and severity of natural disasters, such as floods, hurricanes, wildfires. Emergency preparedness and response. Predictive analytics can enhance emergency preparedness and response efforts by forecasting the impact of natural disaster, disease outbreaks, and other public health emergencies. By predicting analytics, by predicting the trajectory of emergencies and assessing their potential consequence, public health agencies can develop robust response plans and allocate resources effectively and coordinate timely intervention to mitigate the impact of public health on public health. Some examples and application for emergency preparedness and response. Early detection of disease outbreaks. AI algorithms analyze diverse data sources, including disease surveillance data, social media activity, and environmental sensors to detect early signs of disease outbreak. For example, predictive models can monitor patterns of illness-related search on search engines and social media platforms to identify clusters of symptoms indicative of potential outbreaks, enabling public health authorities to initiate timely response measures. Forecasting disease spread. AI-driven predictive analytics can forecast the spread of infectious disease based on mathematical models and real-time data inputs. For instance, predictive models can analyze disease transmission dynamics, population mobility patterns, environmental factors to predict the geographic spreads and trajectory of disease outbreak, guiding resource allocation and intervention strategies. Healthcare resource allocation. AI algorithms analyze healthcare data, including hospital admission, emergency department visits, and bed occupancy rate to forecast healthcare resource needs during public health emergencies. Predictive models can predict surge in patient demand and assist in allocating resources such as hospital beds, ventilators, and medical supplies to areas with the greatest needs. Geospatial analysis for risk assessment. AI-driven predictive analytics leverage geospatial data and geographic information system to assess geographic vulnerability and identify high-risk areas for public health emergencies. For example, predictive models can analyze demographic data, infrastructure map, and environmental factors to assess vulnerability to natural disasters, such as hurricane, floods, and wildfire, and inform emergency preparedness and response plan. Social network analysis for communication strategies. AI algorithm analyze social network data to understand communication patterns and identify influential individuals or communities for disseminating public health information during emergencies. Supply chain management. AI-driven predictive analytics optimize supply chain management by essential goods and medical supplies during public health emergencies. Predictive models can forecast demand for medical equipment, pharmaceuticals, and personal protective equipment based on disease trends and population needs, enabling proactive procurement and distribution strategies to ensure adequate supply availability. And finally, decision support system for emergency operation. AI-driven decision support system provide real-time insight and recommendation to emergency response teams during public health emergencies. Predictive model can analyze situational data, resource availability, and response options to inform decisions making and optimize emergency operations such as evacuation, sheltering, and resource allocation. All this example illustrate how AI-driven predictive analytics enhances public health emergency preparedness and response by providing actionable insight, optimizing resource allocation, and facilitating timely interventions to mitigate the impact of emergencies on public health and safety. يبقى احنا اتكلمنا how AI-driven predictive analytics can be applied in public health واتكلمنا عن كذا area زي disease surveillance and outbreak prediction, risk assessment and stratification, healthcare resource allocation, identifying social determinants of health, behavioral analysis and intervention, environmental health monitoring, emergency preparedness and responses. كده احنا اتكلمنا في البريدكتيف اناليسيس عن الداتا سورسز، ازاي الداتا دي بتعمل لها اناليسيس what is happening now and what is happened and why it is happened and to predict what is going to happen in the future. في حاجة ما كانتش واضحة في المحاضرة دي، أستأذن حضراتكم ابعتوا لي على الشات. شكرا جدا. Thank you very much. دقيقتين ونبتدي إن شاء الله السيشن اللي بعديها. شكرا. Let's continue our sessions. we talked about artificial intelligence definitions, about what is public health and what is the application of artificial intelligence in public health. We talked about in the second sessions about disease surveillance and monitoring system using artificial intelligence. And in the third session, we talked about predictive analytics in public health. Now we'll talk about artificial intelligence-based decision support system for public health. AI is providing new ways to improve the accuracy, speed, and efficiency of clinical decision-making. With the ability to analyze vast amount of patient data, AI is helping doctors and healthcare professionals to make more informed and accurate decisions. AI-based decision support systems have shown significant promise in public health by using AI technique to analyze data, provide insight, and support decision-making processes. This system plays an important role in various aspects of public health, including disease surveillance, outbreak prediction, resource allocation, and personalized health intervention. AI-based decision support system can analyze vast amount of data from various sources, such as electronic health records, social media, and environmental sensors to monitor disease trends and detect potential outbreaks early. By identifying patterns and anomalies in the data, this system can help public health authorities take proactive measures to prevent the spread of diseases. In public health emergencies or resource-constrained settings, AI-based decision support system can assist in optimizing resource allocation by analyzing factors like population demographics, healthcare infrastructure, disease prevalences. This system can recommend efficient distribution of resources, such as vaccine, medical supplies, personnel, to area most in need. Also, AI technologies enable the development of personalized healthcare interventions tailored to individual needs and risk factors. Decision support system powered by AI can analyze genetic data, lifestyle information, and clinical history to recommend personalized prevention strategies or treatment plans for chronic conditions like cardiovascular diseases or diabetes. Overall, AI-based decision support systems hold great potential in enhancing public health efforts by providing timely insight, improving resource management, and enabling personalized intervention for better health outcome. Clinical decision support system in health information technology system that is designed to provide health professionals with clinical decision support, namely to assist with clinical decision-making tasks. How AI is transforming clinical decision support systems. AI-based clinical decision support system have the ability to analyze large volumes of data and suggest next step for treatment, indicate potential problems, enhance efficiency, and facilitate the work of healthcare providers. It can use the information collected from patients' health data, like, for example, data collected through electronic health records. This new state of affairs is possible mainly because of two reasons. Firstly, because of the high amount of clinical data available, which can be obtained in real time from medical devices and records. Secondly, because of the advances performed in AI enabling this vast amount of data to be analyzed and optimally used. AI clinical decision support system can improve diagnosis, treatment, and prognosis of a particular medical condition by predicting the probability of a medical outcome or the risk for a certain disease. AI clinical decision support system can analyze past, current, and new patients' data and identify or suggest safety concerns, errors, or care pathways improvement to the user. Their ability to predict with high relevance and precision leads to new ways of optimizing patient care. AI-driven clinical decision support system. Clinical decision support systems are interactive software systems designed to aid healthcare professionals in making clinical decisions. They provide evidence-based knowledge and patient-specific information at the point of care, which can improve the quality of care and reduce medical errors. AI-driven clinical decision support system can be integrated into various clinical workflow, including electronic health records, computerized physician order entry systems, and remote monitoring devices. What is the components of AI-driven clinical decision support system? This system typically consists of three main components. A knowledge base. A knowledge base contains clinical guidelines, or algorithm, and best practices derived from scientific research and clinical experiences. The patient database, which stores relevant patients' information, such as demographics, medical history, lab results, medication, and the user interface, which enable healthcare professionals to interact with the system and access decision support at the point of care. What are the type of driven clinical decision support system? عندنا diagnostic support system, therapeutic decision support system, medication decision support system, clinical flow optimization system, population health management system, public health surveillance system, telehealth and remote monitoring system. First, the diagnostic support systems. The systems assist the healthcare providers in diagnosing diseases and conditions by analyzing patient data, including symptoms, medical history, laboratory test results, and imaging studies. AI algorithm can help identify patterns and correlation in patient data to support differential diagnosis and recommend appropriate diagnostic tests and interventions. Diagnostic support systems have emerged as crucial tool in the field of public health, particularly in the context of clinical decision-making. The systems use AI and machine learning algorithms to analyze complex data sets and provide accurate diagnosis and recommendation for preventive measures. In this response, we will discuss the role of diagnostic support system in public health, for example. For application of diagnostic support system, radiology, imaging, AI. AI algorithms analyze medical imaging data such as X-ray, CT scans, MRI to assist radiologists in detecting and diagnosing abnormalities. For instance, AI-driven system can detect early signs of lung cancer on chest X-ray, or identify abnormalities in mammograms for breast cancer screening. This system improves diagnostic accuracy, reduce interpretation time, and enable earlier detection of diseases, leading to improved patient outcomes. Dermatology AI. AI-driven dermatology system analyze images of skin lesions to assist dermatologists in diagnosing skin conditions such as melanoma, psoriasis, eczema. For example, AI algorithm can classify skin lesions based on visual characteristics, identify suspicious mole for skin cancer screening, and recommend appropriate follow-up care. This system enhances diagnostic accuracy, facilitate early detection of skin diseases, and improve patient management. Pathology AI. AI algorithm analyze histopathology, slides, and tissue samples to assist the pathologist in diagnosing diseases such as cancer, infectious diseases, and autoimmune disorders. For instance, AI-driven system can detect cancerous cell on pathology slides, classify tumors, subtypes, and predict the patient prognosis based on histological features. This system enhances diagnostic consistency, reduce diagnostic errors, and improve patient stratification and treatment planning. Clinical decision support for infectious diseases. AI-driven diagnostic support system analyze clinical and laboratory data to assist healthcare providers in diagnosing infectious diseases such as COVID-19, influenza, tuberculosis. For example, AI algorithm can interpret laboratory test results, identify pathogen strains, and predict disease severity or transmission risk. This system enables rapid diagnosis, early detection of outbreaks, and effective management of infectious diseases, contributing to public health, surveillance, and response efforts. Genomic medicine AI. AI-driven genomic diagnostic support system analyze genetic data to assist the clinicians in diagnosing genetic disorders and cancer predisposition syndrome. For instance, AI algorithm can interpret genomic sequencing data, identify disease-causing genetic mutation, and predict the patient risk for inherited conditions. This system enables personalized medicine approach, facilitate genetic counseling, and inform preventive interventions for individuals and families at risk of genetic diseases. Point-of-care diagnostic AI. AI-driven diagnostic support system deployed at the point of care provide real-time diagnostic assistance to healthcare providers in clinical settings, such as hospitals, clinics, and primary care settings. For example, handheld devices equipped with AI algorithm can analyze physiological data such as vital signs, blood glucose level, and electrocardiogram to assist the clinicians in diagnosing acute conditions, monitoring chronic diseases, and guiding treatment decisions. These systems enable rapid diagnosis, timely intervention, and improved patient management at the point of care. This example illustrates the diverse application of diagnostic support systems at AI-driven clinical decision support system in public health. زي ما قلنا type of AI-driven clinical decision support system. Number 1, diagnostic support system. Number 2, therapeutic decision support system. This system provides recommendations for treatment options, medication management, and therapeutic interventions based on evidence-based guidelines, clinical protocols, and patient-specific factors. AI algorithm can analyze patient data, including comorbidities, medication history, and treatment response to personalize treatment plans and optimize therapeutic outcomes. Some examples and application of therapeutic decision support system. medication management. AI-driven clinical decision support system for medication management analyze patient data, including medical history, laboratory results, medication profile, to assist healthcare providers in prescribing appropriate medications and dosage. This system checks for drug-drug interactions, allergies, contraindications, and potential adverse effects, helping to prevent medication errors and improve patient safety. Treatment guideline adherence. Therapeutic decision support system provide recommendation based on evidence-based treatment guidelines, clinical protocols, and best practices. This system helps healthcare providers adhere to treatment guidelines by making suggestions, appropriate diagnostic tests, medications, and interventions based on patient-specific factors such as age, comorbidities, disease severity. Personalized treatment plans. AI-driven clinical decision support system personalize the treatment plans based on individual patient characteristics, preferences, and treatment goals. For example, this system can recommend tailored treatment options for chronic conditions such as diabetes, such as hypertension, or asthma, taking into account patients' preferences, lifestyle factors, and treatment adherence. Precision medicine initiatives. Therapeutic decision support systems support precision medicine initiatives by analyzing genetic, molecular, and clinical data to identify optimal treatment strategies for individual patients. For instance, this system can interpret genomics sequencing data, identify actionable genetic mutation, and recommend the targeted therapies or clinical trials based on molecular biomarkers and tumor profiles. Chronic disease management. AI-driven clinical decision support system assists in managing chronic diseases by providing recommendations for disease monitoring, medication adjustment, and lifestyle interventions. This system helps healthcare providers optimize disease management strategies and also improve patient adherence to treatment regimen and prevent disease complications through timely intervention and follow-up care. Decision support for infectious diseases. From the application of therapeutic decision support system is the decision support for infectious diseases. Therapeutic decision support system assists in the management of infectious diseases by providing recommendations for antimicrobial therapy, infection control measures, and outbreak response strategies. For example, this system can analyze microbiological data, antibiotic susceptibility profiles, and the epidemiological information to guide antimicrobial selection and dosing, optimize treatment outcomes, and prevent antimicrobial resistance. Adverse event monitoring and management. AI predictive clinical decision support system monitor for adverse drug reactions, medication errors, and treatment-related complications to improve patient safety and quality of care. This system analyzes clinical data, patient outcomes, and adverse event reports to identify potential safety concerns, provide real-time alerts to healthcare providers, and facilitate appropriate intervention to mitigate risk and prevent harm to patients. Finally, in palliative care and end-of-care decision support, therapeutic decision support system assists healthcare providers in making treatment decisions for patients receiving palliative care and nearing the end of life. These systems help healthcare providers address symptom management, advance care planning, and shared decision-making with patients and their families, ensuring that care is aligned with health, with patient preferences, values, and goals. This example demonstrates the diverse application of therapeutic decision support system as AI-driven clinical decision support system in public health. The benefit of therapeutic decision support system in public health is enhanced diagnostic accuracy. Therapeutic decision support system can help healthcare professionals accurately diagnose diseases by analyzing symptoms, medical history, test results. This can lead to early detection and timely intervention, improving patient prognosis. Number 2, personalized treatment plans. AI-powered therapeutic decision support system can recommend personalized treatment plans based on individual patient characteristics, such as genetic makeup, lifestyle factors, and comorbidities. This tailored approach can enhance treatment efficacy and reduce adverse effects. Number 3, resource optimization. By streamlining decision-making processes and recommending evidence-based practices, therapeutic decision support system can optimize resource allocation within public health systems. This can lead to cost saving, improved efficiency, and better overall healthcare delivery. And number 4, continuous learning and improvement. AI-driven therapeutic decision support system have the capability to continuously learn from new data input and refine their algorithm over time. This adaptive nature ensures that the systems stay up to date with the latest medical advancement and best practices. In conclusion, therapeutic decision support system powered by AI have the potential to revolutionize clinical decision-making in public health by improving diagnostic accuracy, personalizing treatment plans, optimizing resource utilization, and enabling continuous learning for better outcomes. التايب تاني نرجع للتايبس of AI-driven clinical decision support system. اتكلمنا على الدايجنوستيك سبورت سيستمز، الثيرابيوتيك ديسيجن سبورت سيستم، الميديكيشن ديسيجن سبورت سيستم. This system assists healthcare providers in prescribing medications by providing alert and recommendations related to drug interactions, allergies, dosage adjustment, and formulary compliance. من examples للapplication for medication support system: drug interaction checking. AI-driven medication decision support system analyze patient medication profiles to identify potential drug interaction أو drug food interaction أو drug allergy interactions. These systems alert healthcare providers to potential adverse effects or reduced efficacy when multiple medications are prescribed concurrently, helping to prevent medication errors and adverse drug reactions. Allergy and contraindication checking. Medication decision support system check for the patient allergies, contraindications, and other safety consideration before prescribing medications. Dosage recommendation. AI-driven medication decision support provide dosage recommendation based on patient-specific factors such as age, weight, renal function, and comorbidities. This system calculates appropriate medication dosage, adjust doses for renal or hepatic impairment, and recommend dose titration strategies to optimize therapeutic outcomes while minimizing the risk of adverse event or toxicity. Formulary compliance and cost consideration. Medication decision support system assist healthcare providers in selecting medications that are on the hospital formulary or covered by the patient's insurance plan. Clinical guidelines adherence. AI-driven medication decision support system adhere to evidence-based clinical guidelines, treatment protocols, best practices when recommending medications. This system considers guidelines from professional medical society, regulatory agency, and pharmacotherapy experts to ensure that prescribed medication are aligned with current standards of care and treatment recommendation. Medication reconciliation. Medication decision support system facilitate medication reconciliations by comparing current medication orders with patient medication histories, including home medication, over-the-counter medication, and supplement. This system identifies discrepancies, medication omission or duplication, and reconcile medication lists to ensure accurate and up-to-date medication records, reducing the risk of medication errors during transition of care. Pharmacogenomic guidance. AI-driven medication decision support system integrate pharmacogenomic data to personalize medication selection and dosing based on individual genetic variation. This system interprets genetic test results, identify actionable genetic variant affecting drug metabolism or response, and recommend medication with favorable pharmacogenomic profile, improving medication efficiency and minimizing the risk of adverse drug reaction. Medication safety alerts and reminder. Finally, medication decision support system provide real-time alerts and reminders to healthcare providers for medication safety considerations, such as high-risk medications, drug lab interactions, or medication administration errors. These systems alert healthcare providers to potential safety concerns, provide actionable recommendations, and promote safe medication practices, enhancing medication safety and patient care quality. اتكلمنا عن التايب اوف اي اي دريفن كلينيكال ديسيجن سبورت سيستم، اتكلمنا عن الدايجنوستيك سبورت سيستم، ثيرابيوتيك ديسيجن سبورت سيستم، الميديكيشن ديسيجن سبورت سيستم. هنتكلم عن الكلينيكال ورك فلو اوبتمايزيشن سيستم. This system optimizes clinical workflows and care processes to improve efficiency, reduce errors, and enhance patient satisfaction. AI algorithm can analyze healthcare data, including patient flow, resource utilization, and wait time to identify bottlenecks, streamline workflow, and optimize resource allocation in healthcare setting. Clinical workflow optimization systems are AI-driven solutions designed to streamline and enhance the efficiency of clinical workflow in healthcare setting. These systems use AI technologies to automate tasks, improve decision-making processes, and ultimately optimize the delivery of care to patients. By integrating AI algorithms and machine learning capabilities, these systems can analyze vast amounts of data, identify patterns, and provide valuable insight to healthcare providers. From the examples and application of clinical workflow optimization system, patient flow management. AI-driven clinical workflow optimization system analyze patient data, including admission, discharge, transfer information, to optimize the patient flow within healthcare facilities. This system predicts patient arrival patterns, bed availability, and discharge times to facilitate efficient bed management, reduce wait times, and improve patient access to care. Appointment scheduling and optimization. Clinical workflow optimization system assists in scheduling patient appointment, procedures, and consultations to maximize healthcare resource utilization and minimize patient wait time. This system analyzes appointment data and patient preferences and provider availability to optimize appointment scheduling, reduce no-show rate, and improve clinic efficiency. For resource allocation and capacity planning, AI-driven clinical workflow optimization system optimizes resource allocation and capacity planning by forecasting healthcare demand, identifying bottlenecks, and allocating resources effectively. This system analyzes patient volumes, staffing level, and equipment utilization to optimize resource allocation, improve workflow efficiency, and enhance patient throughput. Operating room optimization. Clinical workflow optimization system optimize operating room schedules and staff assignments and equipment utilization to maximize surgical throughput and minimize wait time for surgical procedures. This system analyzes surgical case volumes, surgeon preferences, and operating room availability to optimize surgical scheduling, reduce cancellation, and improve operating room efficiency. For emergency department triage and management, AI-driven clinical workflow optimization system assists in emergency department triage and management by prioritizing patient care based on clinical urgency, resource availability, and patient equity. This system analyzes emergency department wait times, patient equity levels, and resource utilization to optimize triage decisions, improve patient flow, and reduce overcrowding. Care coordination and care transition. Clinical workflow optimization system facilitate care coordination and care transition by streamlining communication and information sharing among healthcare providers, patients, and caregivers. The systems track patient progress, coordinate interdisciplinary care plan, and facilitate smooth transitions of care between healthcare settings to improve care continuity and patient outcomes. Also, in telehealth workflow optimization, AI-driven clinical workflow optimization system optimize telehealth workflows and virtual care delivery processes to improve access to healthcare services and enhance patient engagement. These systems analyze telehealth appointments data, patient preferences, and provider availability to streamline telehealth scheduling and facilitate virtual consultations and optimize remote care delivery. In quality improvement initiatives, clinical workflow optimization systems support quality improve initiatives by identifying inefficiencies, workflow bottleneck, and opportunities for process optimizations. The system analyzes workflow data, performance metrics, and patient outcomes to identify area for improvement, implement workflow changes, and monitor the impact of quality improvement interventions on care delivery and patient outcome. This example demonstrates the diverse application of clinical workflow optimization system as AI-driven clinical decision support system in public health. يبقى احنا بنتكلم عن ال types of AI-driven clinical decision support system اتكلمنا على الدايجنوستيك سبورت سيستم، الثيرابيوتيك ديسيجن سبورت سيستم، ميديكيشن ديسيجن سبورت سيستم، والكلينيكال ورك فلو اوبتمايزيشن سيستم. هنتكلم عن البوبوليشن هيلث مانجمنت سيستم. This system support population health management initiatives by analyzing population level data, identifying high-risk individuals, and implementing preventive intervention to improve health outcomes and reduce healthcare costs. AI algorithm can analyze electronic health records, claims data, and social determinants of health to stratify population based on health risk, predict healthcare utilization patterns, and targeted intervention to high-risk groups. Examples and application of population health management system is the risk stratification and predictive modeling. Population health management systems analyze electronic health records and claim data and other healthcare data sources to stratify and predict future healthcare utilization. These systems use machine learning algorithms to identify potential individuals at higher risk of developing chronic diseases, experiencing adverse health outcomes, or requiring costly healthcare services, enabling targeted intervention to prevent or mitigate these risks. Chronic disease management. AI-driven population healthcare management systems support the management of chronic diseases such as diabetes, such as hypertension, heart diseases, by providing personalized care plans, medication management recommendations, and lifestyle interventions tailored to individual patient needs. The system monitors patient health indicators, track disease progression, and provide real-time feedback to patients and healthcare providers, enabling proactive disease management and improved patient outcomes. Preventive care and health promotion. Population health management system promote preventive care and health promotion initiatives by identifying gaps in vaccinations, programs, in recommending preventive screening, engaging patient in wellness programs. This system use predictive analytics to assess population health risk and prioritize preventive interventions and track adherence to clinical guidelines, helping to prevent disease onset and reduce healthcare costs associated with preventable conditions. Care coordinations and care management. AI-driven population health management system facilitate care coordination and care management for complex, high-risk patients by integrating care plans, on coordinating services, and facilitating communication among healthcare providers and patient and caregivers. This system identifies patients with complex care needs, facilitate interdisciplinary care coordination, and monitor care transition to ensure seamless continuity of care and prevent care fragmentation. Patient engagement and self-management. Population health management system engage patients in their own care by providing personalized health information, self-management tools, and behavioral intervention tailored to individual patient preferences and needs. The system uses predictive analytics to identify patients at risk of non-adherence to treatment plans, providing motivational support and education, and empower patients to take an active role in managing their health and well-being. Other example, in social determinant of health integration, AI-driven population health management system integrate social determinant of health data such as socioeconomic status, housing stability, and access to healthcare services into risk stratifications models and care plans. These systems identify social risk factors that impact health outcomes, address social determinants of health through targeted interventions, and promote health equity by addressing underlying social inequities that contribute to health disparities. In community health need assessment, population health management system conduct community health needs assessment by analyzing population-level health data, identifying community health priorities, and developing strategies to address public health challenges. These systems use geospatial analytics, epidemiological data, and community health indicators to inform public health planning, resource allocation, and community-based interventions aimed at improving population health outcomes. Finally, in health equity and health disparities reduction, AI-driven population health management system prioritize health equity initiatives by identifying addressing health disparities and promoting inclusive and cultural component care delivery. This system uses predictive analytics to assess health disparities, targeted intervention to underserved communities, and advocate for policies and programs that address social determinant of health and promote health equity. This example illustrates the diverse application of population health management system as AI-driven clinical decision support system in public health. Now we'll talk about the public health surveillance system. These systems monitor disease trends, detect outbreaks, and track the spread of infectious diseases in populations. AI algorithm can analyze disease surveillance data, environmental factors, and social media data to identify unusual patterns or clusters of symptoms indicative of potential outbreak, enabling timely public health intervention and response efforts. For examples, some application of public health surveillance system: early detection of disease outbreak. AI-driven public health surveillance system analyze syndromic surveillance data and electronic health records and other healthcare data sources to detect early signs of disease outbreaks. These systems use machine learning algorithms to identify abnormal patterns in disease incidence, symptoms clusters, or healthcare-seeking behavior, enabling timely detection and response to outbreak of infectious diseases such as influenza, COVID-19, foodborne illness. Also in disease modeling and forecasting, AI-driven public health surveillance system use predictive modeling techniques to forecast disease spread, estimate disease burden, and project future health care needs. This system integrates epidemiological data, demographic information, environmental factors, and social determinant of health into diseases model to predict disease transmission dynamics, to assess the impact of interventions, and to inform public health planning and resource allocation efforts. Also in sentinel surveillance and syndromic surveillance, AI-driven public health surveillance system implement sentinel surveillance and syndromic surveillance approach to monitor disease trends and detect unusual patterns in healthcare data. These system analyze data from healthcare facilities, emergency departments, and other sentinel sites to identify increases in specific symptoms, syndromes, or diagnoses that may indicate potential outbreaks or emerging health threats, facilitating early detection and response. Also in social media and internet-based surveillance, AI-driven public health surveillance system monitor social media platforms, online forum, and internet search query to track public health concerns, health-related behaviors, and disease-related discussions in real time. The system uses natural language processing and sentiment analysis technique to extract relevant information from social media posts, identify emerging health trends, and assess public perceptions and attitudes toward health issues, enabling targeted public health care messaging and response efforts. In the environmental health surveillance, AI-driven public health surveillance system integrates environmental monitoring data, such as air quality, water quality, weather data, into disease surveillance effort to assess environmental health risk and inform public health interventions. In vector surveillance and vector-borne disease monitoring, AI-driven public health surveillance system monitor vector populations, such as mosquitoes and ticks, to assess the risk of vector-borne diseases, such as malaria, dengue fever, Lyme disease. This system uses geospatial analytics, remote sensing data, and ecological modeling technique to track vector distribution, abundance, and behavior, enabling early warning systems and targeted vector control measures to prevent disease transmissions. One Health surveillance. AI-driven public health surveillance system adopt a One Health approach, integrating data from human, animal, and environmental health sectors to monitor zoonotic diseases, antimicrobial resistance, and other health threats at the human-animal environment interface. Global health surveillance and international collaboration. AI-driven public health surveillance systems support global health surveillance efforts by monitoring disease trends, sharing data, and facilitating international collaboration and information exchange. This system contributes to global disease surveillance network, such as WHO, by providing real-time disease intelligence, supporting outbreak investigation, and coordinating response effort across borders. This example illustrates the diverse application of the AI-driven public health surveillance system as clinical decision support system in public health. Finally, we'll talk now about the telehealth and remote monitoring system. This system enables remote consultations, virtual care delivery, and remote patient monitoring to improve access to healthcare services and enhance patient engagement. AI algorithm can analyze remote monitoring data such as vital signs, activity levels, and medication adherence to detect changes in patient health status, provide real-time feedback to patients and healthcare providers, and prevent adverse events. Some examples and application of telehealth and remote monitoring system is the remote patient monitoring. AI-driven remote monitoring system enable healthcare provider to monitor patient health status remotely, collect real-time physical data, and identify early signs of deterioration or disease progression. These systems use wearable devices, smart sensors, mobile health application to monitor vital signs, activity levels, medication adherence, providing continuous monitoring and timely intervention for patients with chronic conditions such as heart failure, diabetes, hypertension, Secondly, telemedicine and virtual consultation. AI-driven telemedicine system facilitate virtual consultations between patients and healthcare providers, enabling remote diagnosis, remote treatment, and remote follow-up care. These systems use video conferencing, secure messaging, digital health platform to conduct telemedicine visits, assess patient symptoms, and provide medical advice, expanding access to healthcare services, particularly in underserved or rural areas with limited access to healthcare facilities. Also, in AI-assisted triage and decision support, telehealth system equipped with AI algorithm assist in triaging people, triaging patients, assessing symptom severity, and guiding clinical decision-making during telemedicine consultations. These systems use natural language processing and machine learning technique to analyze patient-reported symptoms, medical history, and risk factors, providing diagnostic support, treatment recommendations, and referral guidance to healthcare providers, improving the accuracy and efficiency of remote triage and diagnosis. Also, in medication adherence monitoring, AI-driven remote monitoring system track medication adherence and medication taking behavior among patients using smart pills bottles, medication dispensers, or mobile health app. This system analyzes medication adherence patterns, identify adherence barriers, and provide personalized reminders, educations, and support to improve medication adherence and treatment outcomes for patients with chronic diseases or complex medication regimen. Also in psychiatry and mental health monitoring. Telehealth systems support mental health assessment, counseling, and therapy through telepsychiatry and virtual mental health services. AI-driven telepsychiatry systems use behavioral analytics, sentiment analysis, and speech recognition to assess mental health symptoms, detect changes in moods or behavior, and provide personalized interventions and support to individuals with mental health conditions, improving access to mental health care services and reducing stigma associated with seeking mental health treatment. Remote chronic disease management program. AI-driven remote monitoring system support remote chronic disease management program by providing personalized care plans, self-management tools, and behavioral interventions to patients with chronic conditions such as asthma, COPD, obesity. This system uses predictive analytics to identify high-risk patients and tailor intervention to individual patients' needs, and empower patients to self-monitor symptoms, track progress, and make informed decisions about their health, leading improved disease management and reduced healthcare utilization. In telehealth enable home health monitoring, telehealth system enable home-based monitoring and care delivery for patients recovering from surgery, managing chronic conditions, or receiving post-acute care. AI-driven home health monitoring system use smart home devices, remote monitoring technologies, and artificial intelligence to assess patient health status, detect changes in condition, and provide real-time alert to healthcare providers, enabling timely intervention and preventing hospital readmission or adverse events. Finally, AI-driven remote diagnostics and imaging telehealth system equipped with AI-driven diagnostic algorithm enable remote interpretation of medical images, such as X-ray, CT scan, and MRI by healthcare providers and radiologists. This system uses deep learning algorithm to analyze imaging data, detect abnormalities, and provide diagnostic support, facilitating remote diagnosis, triage, and treatment planning for patients in remote or area with limited access to radiology services. These examples demonstrate the diverse application of AI-driven telehealth and remote monitoring systems as clinical decision support systems in public health. These types of AI-driven clinical decision support system in public health demonstrates the diverse applications of AI in improving clinical decision-making, optimizing healthcare delivery, and promoting population health outcome by using advanced algorithms and healthcare data. AI-driven clinical decision support empower healthcare providers and public health practitioners and policymakers to make informed decisions and deliver personalized care and improve healthcare outcome for individuals and communities through diagnostic support system, therapeutic decision support system, medication decision support systems, clinical workflow optimization system, population health management systems, public health surveillance system, and telehealth and remote monitoring systems. أشكر حضراتكم. لو في حاجة مش واضحة أستأذن حضراتكم ممكن تبعتولي على الشات. Thank you very much. مساء الخير. كمل مع حضراتكم. كنا بنتكلم عن definition of AI, definition of public health, the application of AI in public health, disease surveillance والmonitoring واستخدامات ال AI في disease surveillance. اتكلمنا عن predictive analytics واتكلمنا عن ال applications of AI for decision support system. هنتكلم عن ال artificial intelligence application in epidemiology and disease modeling, public health strategies and interventions. الepidemiology public health strategies and interventions. Public health strategies and intervention in epidemiology play an important role in preventing and controlling diseases within populations. These interventions are based on scientific evidence, data analysis, and the severity of the public health problem at hand. Here are some key points regarding epidemiology, public health strategies and interventions. The severity of the problem. The severity of a public health problem determines the urgency and nature of interventions. Factors such as consequence of the event, probability of occurrence, symptoms, duration of illness, complications, case fatality rate, treatment needs, and economic impact influence the severity assessment. For example, high consequence event like botulism trigger extensive investigations due to their potential impact on public health. The level of certainty about agents, sources, and mode of spreads. Apart from the severity, certainty about the causative agents, sources, and modes of spread influences the aggressiveness and scope of epidemiologic investigations. Control measures are formulated based on knowledge about the etiology and transmission routes, etiology of pathogen or toxic agents, and the transmission route like waterborne, airborne, vector-borne. The level of certainty guides decision-making on when to implement specific intervention during an outbreak. Disease modeling for public health strategies and intervention. Mathematical modeling plays an important role in public health policymaking by providing valuable insight into the potential impact of various interventions and strategies. It allows policymakers to stimulate different scenarios, predict outcomes, and make informed decisions based on quantitative data. In the context of infectious diseases like influenza, Ebola, HIV, COVID-19, mathematical modeling has been instrumental in guiding public health responses and shaping policy decisions. What is the role of mathematical modeling in health policy support? Mathematical modeling helps synthesize information from diverse sources into a cohesive framework for integrated analysis. This enables researchers to stimulate the effect of intervention and predict how they might influence people health models. Models are used to estimate key parameters for outbreak control, evaluate vaccination strategies, and design trials during public health emergencies. In chronic disease management, models project population health based on demographic change, risk factors, and intervention programs. AI has become an essential tool in various fields, including epidemiology and disease modeling, where it is used to develop public health strategies and intervention. AI application in epidemiology and disease modeling have a great way in public health for public health professionals approach in disease surveillance, prediction, and control. One of the primary uses of AI in this field is for analyzing large data set for identify patterns and trends that may not be apparent through traditional methods. This can include analyzing data from electronic health records, satellite, imaginary, social media, other sources to identify outbreak or monitor the spread of diseases. The artificial intelligence application in epidemiology and disease modeling are used to make interventions and strategies for enabling advanced data analysis, predictive modeling, decision support. The key AI application in disease modeling, public health strategies and intervention, disease surveillance, and early warning system. AI-driven surveillance system analyze diverse data sources, including clinical data, syndromic surveillance data, social media feeds, and environmental sensors to detect early signs of disease outbreaks and emerging health threats. Machine learning algorithms can identify abnormal patterns in disease incidence, symptoms, reporting, or healthcare seeking behavior, enabling timely detection and response to outbreak of infectious diseases such as influenza, COVID-19, foodborne illness. From the AI application of disease surveillance and early warning system, automated data collection and integration. AI automates the collection and integration of vast and heterogeneous data sources, including electronic health records, laboratory reports, syndromic surveillance data, social media feeds, and environmental sensors. These integrated data provide a comprehensive understanding of disease trends and patterns, facilitating early detection of outbreaks and targeted intervention strategies. Number 2 is the anomaly detection and pattern recognition. AI algorithms detect anomalies and identify patterns in disease data, enabling the early detection of outbreaks and emerging health threats. By analyzing historical data and real-time surveillance data, AI can identify unusual spikes in disease incidence, recognize disease cluster, and distinguish between normal fluctuation and signals of potential outbreaks. Also in predictive modeling and forecasting. AI-powered predictive models forecast disease spread, estimate disease burden, and evaluate the impact of public health interventions. By analyzing epidemiological data, demographic information, environmental factors, and other relevant variables, AI models predict future disease trends and assess the effectiveness of intervention strategies, guiding resource allocation and decision-making. In syndromic surveillance and signal detection, AI algorithms analyze syndromic surveillance data from healthcare facilities, emergency department, and other sources to detect disease outbreak in real time. Natural language processing technique analyzed unstructured data sources, such as social media posts and news reports, to identify disease-related signals and early warning signs, enabling rapid response and intervention. Also in geospatial analysis and spatial epidemiology. AI-powered systems use geospatial analysis to map disease transmission dynamics and identify high-risk areas. By analyzing spatial and temporal relationship between cases, population density, and environmental factors, AI identify geographic clusters and hotspot areas, guiding targeted intervention strategies and resource allocation efforts. Also in automated alerting and decision support, AI application automates the generation of early warning alerts and decision support tools for public health practitioners and policymakers. Machine learning algorithms prioritize alerts based on their relevance and urgency, facilitating timely response and intervention planning. Decision support systems provide actionable insight and recommendation based on real-time surveillance data and predictive modeling output. In continuous learning and adaptation, AI-powered systems continuously learn from new data and adapt their algorithms and models over time. By analyzing feedback from surveillance articles and interventions outcomes, AI systems improve their predictive accuracy, refine their algorithm, and enhance their ability to detect and respond to evolving health threats. In the integration with public health response systems, AI applications integrate seamlessly with public health response systems, such as emergency preparedness platforms and communication networks, by providing real-time data feed, predictive analytics, and decision support capabilities. AI-powered systems support coordinated response efforts, facilitate information sharing, and optimize resource allocation during disease outbreak and public health emergencies. These applications in disease surveillance and early warning systems empower public health agencies to enhance their surveillance capabilities, improve outbreak detection, and mitigate the impact of infectious diseases on population. Number 2, we'll talk about epidemiological data analysis and risk assessment. AI techniques such as data mining and pattern recognition analyze large-scale epidemiological data set to identify risk factors associated with disease occurrence and transmission. Machine learning algorithms can uncover complex relationships between demographic factors, environmental exposure, and disease outcomes, providing insight into disease etiology, population vulnerability, and the opportunities for targeted interventions to reduce disease burden. From the AI application of epidemiological data analysis and risk assessment is pattern recognition and disease clustering. AI algorithms can analyze large-scale epidemiological datasets to identify patterns and clusters of diseases. By applying machine learning techniques such as clustering algorithms, AI can detect geographic or demographic clusters of diseases, aiding in the identification of potential outbreaks and the implementation of targeted interventions. Number 2 is the predictive analytics for disease trends. AI-driven predictive analytics can forecast disease trends based on historical epidemiological data, environmental factors, and demographic information. By utilizing techniques such as time series analysis and machine learning models, AI can predict the future disease incidence and prevalences and spread, providing valuable insight for resource allocation and intervention planning. For the identification of risk factors and determinants, AI application can analyze epidemiological data to identify risk factors and determinants associated with disease occurrence and transmission. By employing advanced statistical methods and machine learning algorithms, AI can uncover complex relationship between genetic, environmental, and social factors, facilitating the identification of high-risk population and the development of targeted prevention strategies. For the personalized risk assessment and stratification, AI-driven risk assessment models can provide personalized risk assessment for individuals based on their health status, genetic predisposition, and lifestyle factors. By integrating clinical data, genomic information, and social determinant of health, AI algorithm can stratify population into risk groups, allowing for tailoring intervention and preventive measures. For early warning system for disease outbreak, AI-powered early warning system can detect signals of potential disease outbreak by analyzing diverse data sources, including syndromic surveillance data, social data feeds, and environmental sensor. By employing machine learning algorithms for anomaly detection and pattern recognition, AI can provide a timely alert to public health authorities, enabling swift response and containment efforts. In the precision public health interventions, AI application enable precision public health interventions by identifying subpopulation at higher risk of disease transmission or poor health outcomes. By using predictive modeling and risk assessment technique, AI can guide the development and implementation of targeted interventions such as vaccination campaigns, screening programs, health promotion initiatives, maximizing the impact of public health efforts. In the integration of multi-omic data for risk assessment, AI algorithm can integrate multi-omic data, including genomics, proteomics, metabolomics, to assess individuals and population-level disease risk. By analyzing large-scale omics dataset, AI-driven models can identify biomarkers, genetic variants, and molecular pathways associated with disease susceptibility, facilitating personalized risk assessment and intervention strategies. Continuous learning and adaptation. AI-driven risk assessment models can continuously learn from new data and adapt their algorithm over time. By analyzing feedback from surveillance activities, interventions outcomes, and changes in disease patterns, AI systems can improve their predictive accuracy and relevance, enhancing their utility in guiding public health strategies and interventions. These AI applications in epidemiological data analysis and risk assessment empower public health practitioners to better understand disease dynamics and identify vulnerable populations and implement targeted interventions to prevent and control diseases. Now we'll talk about the predictive modeling and forecasting. AI-driven predictive modeling techniques, including machine learning and deep learning, forecast disease spread, estimate disease burden, and evaluate the potential impact of public health interventions. Epidemiological models leverage AI algorithms to simulate disease transmission dynamics and predict disease trends and assess the effectiveness of controlled measures, enabling proactive planning, resource allocation, and decision-making to mitigate the impact of diseases on population. From the AI application of predictive modeling and forecasting is the disease spread prediction. AI-driven predictive models can forecast the spread of infectious diseases based on historical epidemiological data, environmental factors, and population dynamics. By employing techniques such as compartmental modeling and machine learning algorithm, AI graphic spread and trajectory of disease outbreak. aiding in the allocation of resources and implementation of control measures. In the epidemic modeling and simulation, AI-powered epidemic models simulate disease transmission dynamics with population, allowing public health authorities to evaluate the potential impact of intervention strategies by incorporating factors such as population demographics, contact patterns, intervention scenarios. AI-driven models can simulate disease outbreak and assess the effectiveness of control measures and inform decision-making in epidemic preparedness and response efforts. Also in real-time forecasting and early warning system. AI applications enable real-time forecasting of disease trends and early detection of outbreak through early warning systems by analyzing diverse data sources, including syndromic surveillance data, social media feeds, and environmental sensors. AI algorithms can detect signals of potential outbreaks and provide timely alerts to public health authorities, enabling proactive responses and containment efforts. Also, from the AI application of predictive modeling and forecasting is the prediction of disease burden and impact. AI-driven models can predict disease burden and assess the potential impact of public health intervention and disease outcomes. By analyzing epidemiological data, demographic information, and intervention scenarios, AI algorithms can estimate disease incidence, prevalence, morbidity, and mortality, providing valuable insight for resource allocation and intervention planning. Also, from the AI application of predictive modeling and forecasting is the risk assessment and stratification. AI application enable risk assessment and stratification of population based on their susceptibility to disease and health outcomes. By integrating clinical data, genetic information, and social determinant of health, AI-driven models can identify high-risk individuals and population, allowing for targeted intervention and preventive measures to mitigate disease risk and improve health outcomes. Also from the AI application is the seasonal and temporal pattern analysis. AI algorithm can analyze seasonal and temporal patterns of disease occurrence, aiding in the prediction of seasonal outbreaks and trends. By employing time series analysis and machine learning techniques, AI-driven models can identify patterns and cycles in disease data, facilitating the prediction of disease peaks, seasonal variation, and long-term trends. The integration with environmental and climate data. Our AI applications integrate environmental and climate data into predictive models to assess the impact of environmental factors on disease transmission. By analyzing factors such as temperature, such as humidity, such as rainfall, AI-driven models can predict disease outbreak and assess climate-related risks and inform adaptation strategies to mitigate the effect of climate change on public health. For the continuous learning and adaptation, AI-driven predictive models can continuously learn from new data and adapt their algorithms over time. By analyzing feedback from surveillance activities, intervention outcomes, and changes in disease patterns, AI systems can improve their predictive accuracy and relevance, enhancing their utility in guiding people health strategies and interventions. This AI application in predictive modeling and forecasting empower public health practitioners to anticipate disease trends, allocate resources effectively, and implement targeted interventions to prevent and control diseases. Also, from the key application in the epidemiology and disease modeling, public health strategies and intervention is the syndromic surveillance and real data analysis. AI-powered syndromic surveillance system monitor real-time health data streams such as emergency department visits, ambulance dispatch, and pharmacy sales to detect disease outbreaks and public health emergencies. Natural language processing algorithms analyze unstructured data sources such as social media posts and newspapers to identify disease-related signals and trends, providing early warning of potential health threats and guiding rapid response efforts. From the AI application of syndromic surveillance and real-time data analysis is the anomaly detection and signal identification. AI algorithms analyze syndromic surveillance data, including emergency department visits, ambulance dispatch, pharmacy sales, to detect unusual patterns indicative of disease outbreaks by employing machine learning techniques such as anomaly detection and pattern recognition. AI can identify signals of potential outbreaks in real time, enabling rapid response and intervention. Also, in early warning systems for disease outbreaks, AI-powered early warning system monitor diverse data sources, such as social media feeds, news reports, environmental sensors to detect signals of emerging health threats. By analyzing unstructured data using natural language processing algorithms, AI can identify disease-related signals and early warning signs, providing timely alert to public health authorities and enabling proactive response and containment efforts. Syndrome classification and case identification. AI application classify syndromic data into relevant disease categories and identify cases of interest for further investigation. By using machine learning algorithms, AI can classify syndromic data based on clinical symptoms, identify disease clusters, and prioritize cases for public health actions, facilitating targeted surveillance and intervention efforts. Geospatial analysis and visualization. AI-powered systems use geospatial analysis technique to map disease transmission dynamics and identify spatial patterns of disease occurrence. By integrating syndromic surveillance data with geographic information system, AI algorithm can visualize disease hotspots, identify high-risk areas, and guide targeted intervention strategies and resource allocation efforts. Integration with environmental and climate data. The AI application integrates syndromic surveillance data with environmental and climate data to assess the impact of environmental factors on disease transmission. By analyzing factors such as temperature, humidity, air quality, AI-driven models can identify environmental risk factors, predict disease outbreaks, and inform adaptation strategies to mitigate the effect of environmental hazards on public health. Also, in automated alerting and decision support, the AI-powered system automate the generation of early warning alerts and decision support tools for public health practitioners and policymakers. By prioritizing alerts based on their relevance and urgency, AI algorithms facilitate timely response and intervention planning. Decision support systems provide actionable insights and recommendations based on real-time syndromic surveillance data, enabling informed decision-making and resource allocation. In the continuous learning and adaptation, AI-driven syndromic surveillance system continuously learn from new data and adapt to their algorithm over time. By analyzing feedback from surveillance activities, outbreak investigations, and interventions outcomes, AI systems improve their predictive accuracy and relevance, enhancing their utility in guiding public health strategies and interventions. From the key applications in epidemiology and disease modeling public health strategies and interventions, اتكلمنا عن disease surveillance and early warning system, epidemiological data analysis, risk assessment, predictive modeling and forecasting, syndromic surveillance and real-time data analysis. هنتكلم عن الجينوميك epidemiology and pathogen genomics. AI techniques such as machine learning and bioinformatics analyze genomic sequencing data to understand the genetic diversity, transmission patterns, and evolutionary dynamics of pathogens. Genomic epidemiology approach integrate genomic data with epidemiological information to trace the spread of infectious diseases, identify transmission clusters, and inform outbreak investigations and control measures, enhancing our understanding of disease emergence and transmission pathway. From the AI application of genomic epidemiology and pathogen genomics, pathogen identification and characterization. AI algorithm analyze genomic sequencing data to identify and characterize a pathogen responsible for infectious diseases by comparing genomic sequence against reference databases and using machine learning techniques. AI can accurately identify pathogens, detect genetic variations, and classify strains, providing valuable information for disease surveillance and outbreak investigation. Another application is the epidemiological surveillance and outbreak detection. AI-driven genomic surveillance system monitor genetic sequence of pathogen in real time to detect outbreak and emerging health threats. By analyzing genomic data from clinical samples and environmental sources, AI algorithm can identify genetic signature indicative of disease transmission, providing early warning of outbreaks and guiding timely public health responses and interventions. Also in antimicrobial resistance prediction and surveillance, the AI application predicts antimicrobial resistance patterns in pathogens based on genomic data and epidemiological information. By analyzing genetic determinant of resistance and resistance-associated mutation, AI algorithm can identify emerging resistance strains, assess the prevalence of resistant genes, and monitor changes in resistance pattern over time, informing antimicrobial stewardship efforts and treatment guidelines. In vaccine development and targeted identification, AI-driven genomic analysis facilitate vaccine development and target identification by identifying conserved regions and immunogenic epitope in pathogen genomes. By analyzing genetic sequence of pathogen and host pathogen interactions, AI algorithm can predict vaccine candidate, design antigenic targets, and optimize vaccine formulations, accelerating the development of vaccine against infectious diseases. In genomic epidemiology and in emerging infectious diseases, AI-powered genomic Epidemiology tools enables the study of emerging infectious diseases and their genetic determinant by analyzing genomic data from outbreaks and pandemics. AI algorithm can elucidate the origin, transmission dynamic, and evolutionary pathway of emerging pathogens, providing insight into disease emergence and informing public health intervention to prevent future outbreak. In the integration with clinical and epidemiological data, AI application integrate genomic data with clinical and epidemiological information to enhance disease surveillance and outbreak investigation. By combining genomic sequencing data with patient demographics, clinical histories, and exposure information, AI algorithm can identify clusters of cases, trace transmission routes, and assess the impact of interventions of disease spread, guiding evidence-based public health responses. In the continuous learning and adaptation, AI-driven genomic epidemiology system continuously learn from new genomic data and adapt their algorithm over time. By analyzing feedback from surveillance activities, outbreak investigations, and genomic sequencing efforts, AI system improves their predictive accuracy and relevance, enhancing their utility in guiding public health strategies and interventions. Now we'll talk about the public health decision support system. AI-driven decision support and recommendation to public health practitioners, policymakers, and healthcare providers to guide evidence-based decision-making and intervention planning. These systems analyze epidemiological data, model outputs, and intervention outcomes to identify effective strategies, optimize resource allocation, and prioritize interventions based on their impact on population health outcomes. From the AI application of public health decision support system, data integration and analysis. AI-driven decision support system integrate diverse data sources, including epidemiological data, clinical records, environmental data, socioeconomic indicators, to provide a comprehensive understanding of public health trends and dynamics. By employing machine learning algorithm for data analysis, decision support system identify patterns, trends, and correlations in large-scale data sets, enabling evidence-based decision-making and intervention planning. In the predictive modeling and forecasting, AI-powered decision support system utilize predictive modeling technique to forecast disease trends, to assess the impact of interventions, and predict the future health outcomes. By analyzing historical data and incorporating relevant variables such as population demographic, environmental factors, and intervention scenarios, decision support system generate predictive models that inform decision makers about potential health risk and guide resource allocation efforts. In the risk assessment and stratification, AI application in decision support systems enable risk assessment and stratification of populations based on their susceptibility to disease and health outcomes. By analyzing demographics, clinical and behavioral data, AI algorithms identify high-risk individuals and communities, allowing for targeted interventions, preventive measures, and resource allocation strategies to mitigate health disparities and improve health outcomes. From the AI application of public health decision support system is the early warning system and alerting mechanism. AI-driven decision support systems provide early warning system and alerting mechanism to detect signals of potential health threats and emerging outbreaks. by monitoring diverse data streams such as syndromic surveillance data, social media feeds, and environmental sensors. AI algorithms identify anomalies and patterns indicative of health emergency, enabling timely response and intervention by public health authorities. Also, from the AI application of public health decision support system is the decision support for intervention planning. AI-powered decision support systems offer decision support tools for intervention plannings and resource allocation in public health emergencies. By analyzing epidemiological data, simulation models, and scenarios projection, decision support system generate recommendations for optimal intervention strategies, such as vaccination campaigns, contact tracing efforts, and quarantine measures to mitigate the spread of infectious diseases and minimize the impact of public health on public health. Also, the resource allocation and optimization. AI application in decision support system assist in resource allocation and optimization by prioritizing interventions, allocating health resources, and optimizing supply chain. By analyzing real-time data on disease incidence, healthcare capacity, and resource availability, AI algorithms guide decision makers in allocating resources effectively, ensuring equitable access to healthcare services and maximizing the effectiveness of public health interventions. Also, from the AI application of public healthcare decision support system is the adaptive decision support and learning systems. The AI-driven decision support system continuously learn from new data and adapt their algorithm and models over time by analyzing feedback from interventions outcomes, surveillance activities, and changes in disease dynamics. Decision support system improves their predictive accuracy and relevance, enhancing their utility in guiding public health strategies and interventions in dynamics and evolving environments. In the integration with public health responses, the AI application in decision support system integrates seamlessly with public health response systems such as emergency preparedness platforms, communication networks, and surveillance systems. By providing real-time data feeds, predictive analytics, and decision support capabilities, decision support system support coordinated response efforts, facilitate information sharing, and optimize resource allocation during public health emergency and disease outbreaks. This AI application of public health decision support system empower public health agency to make informed decisions, implement evidence-based interventions, and respond effectively to public health emergencies and disease outbreaks. From the AI application in epidemiology and disease modeling, public health strategies and intervention, we'll talk now about the health risk prediction and stratification. AI algorithms predict individual health risks and stratify population based on their susceptibility to disease, enabling targeted intervention and personalized healthcare approach. Predictive analytics model use patient data, including clinical histories, genetic profiles, social determinant of health, to assess disease risk factors and predict disease onset and recommend preventive interventions tailored to individual patients' needs, ultimately improving health outcomes and reducing healthcare disparities. From the AI application of health risk prediction and stratification using AI is the disease forecasting. AI models can analyze vast amount of health data, including demographics, environmental factors, and past disease pattern to forecast disease outbreak. This help public health authority prepare and allocate resources effectively. Number 2 is the early disease detection. AI algorithm can detect subtle patterns in health data that may indicate the early stage of disease development. By identifying at-risk individuals, early interventions can be initiated to prevent the progression of the disease. Number three is the risk assessment models. Machine learning models can analyze various risk factors such as genetic predisposition, lifestyle choices, and environmental exposures to predict an individual's likelihood of developing a particular disease. This information can be used for targeted interventions and personalized healthcare. Also, stratified interventions. AI can stratify populations based on their risk profiles, allowing public health intervention to be tailored to specific groups. For example, high-risk individuals may receive more frequent screenings or targeted educational campaigns to promote healthier behaviors. For resource allocation, by predicting the future burden of diseases in different regions or populations, AI models can help allocate healthcare resources efficiently. This includes staffing, medical supplies, and infrastructure planning, optimizing treatment plans. AI can analyze patient data to recommend personalized treatment plans based on individual risk factors and genetic profiles and treatment responses. This ensures that patients receive the most effective and appropriate care. In the behavioral interventions, AI-powered healthcare risk prediction models can identify individuals at risk of unhealthy behaviors, such as smoking, sedentary lifestyle. Targeted interventions can then be designed to promote healthier behavior and prevent chronic diseases. Public health policies. Insights from AI models can inform the development of public health policies aimed at reducing overall disease burden. For example, policies related to smoking cessation programs or vaccination campaigns or environmental regulations can be tailored based on predicted disease risks. In monitoring and surveillance, the AI algorithm can continuously monitor health data streams from various sources, including electronic health records, wearable devices, and social media, to detect emerging health threats and track disease trends in real time. In research and development, AI techniques can accelerate the process of drug discovery and development by identifying potential drug candidates, predicting their efficacy, and optimizing clinical trial design based on predictive models of disease progression. Overall, AI-driven health risk prediction and stratification hold great promise for improving public health outcomes by enabling proactive interventions and optimizing resource allocation and informing evidence-based policies and strategies. Lastly, we'll talk about the vaccine development and drug discovery. AI-driven approach accelerate vaccine development and drug discovery efforts by analyzing large-scale biological data sets, identifying potential drug targets, and designing novel therapeutics. Machine learning algorithms predict protein structures, assess drug target interactions, and prioritize candidate molecule for preclinical testing, streamlining the drug discovery process and facilitating the development of vaccines and treatment for emerging infectious diseases and other public health threats. From the AI application of vaccine development and drug discovery is the target identification. AI algorithm can analyze biological data to identify potential targets for vaccines or drug therapies. This includes predicting protein structures, identifying antigenic regions, and understanding the molecular mechanism of disease. The virtual screening. AI-driven virtual screening methods can efficiently screen large libraries of chemical compounds to identify potential drug candidates. This accelerates the drug discovery process by narrowing down the search space for promising molecules. Drug repurposing. AI models can analyze existing drugs and their interactions with biological targets to identify candidates for repurposing. This approach leverages existing safety and efficacy data to expedite the development of treatment for new indications. Regional drug design. AI techniques such as machine learning and molecular modeling enables the design of novel drug molecules with desired properties. By predicting how molecules will interact with biological targets, researchers can optimize drug candidate for efficacy and safety. From the AI application of vaccine development and drug discovery is the clinical trial optimization. AI algorithm can analyze the patient data to optimize the clinical trial designs, including patient selection criteria, dosage regimen, and endpoint selection. This improves the efficacy of clinical trials and accelerates the development of new vaccines and drugs. Also, in vaccine designs and optimization, AI can aid in the design of vaccines by predicting antigen structures, optimizing vaccines formulations, and predicting immune responses. By enables the development of more effective and targeted vaccines against infectious diseases. Adverse event prediction. AI models also can analyze the clinical and biological data to predict the potential adverse event associated with vaccines and drug therapies. Early detection of adverse event allows for timely intervention and mitigation strategies. In drug safety assessment, AI techniques such as deep learning can analyze large-scale data sources, including electronic health records and biomedical literature, to identify potential safety concerns associated with drugs. This helps regulators and healthcare providers make informed decisions about drug safety. In real-world evidence generation, AI-powered analysis of real-world data sources such as electronic health records, claims data, and social media can generate insight into the effectiveness and safety of vaccines and drugs in diverse patient population. And finally, in the personalized medicine, AI-driven approach enable the development of personalized vaccines and treatment tailored to our individual's vaccine characteristic, including genetic makeup, immune response profile, and lifestyle factor. يبقى اتكلمنا عن الكي AI application in epidemiology and disease modeling, modeling public health strategies and interventions في disease surveillance and early warning system, epidemiological data analysis and risk assessment, predicting modeling and forecasting, syndromic surveillance and real-time data analysis, genomic epidemiology pathogen genomic, public health decision support systems, health risk predictions and stratification, vaccine development, and drug discovery. These AI application in epidemiology and disease modeling complement traditional public health strategies by enhancing data analysis capabilities, real-time decision-making in response to evolving health threats. By using AI technologies, public health practitioners can strengthen disease surveillance system, optimize the intervention strategies, and mitigate the impact of diseases on population, ultimately advancing global health security and promoting population health and well-being. Thank you very much. لو في أي أسئلة أستأذن حضراتكم ابعتوا لي في الشات. If any questions, please send me in any comment. Thank you very much. 5 دقايق ونبتدي السيشنز الأخيرة إن شاء الله. شكرا جدا. We talked about the artificial intelligence in public health, the application of artificial intelligence in public health generally. Then we talk about the application in disease surveillance and monitoring, the predictive analytics, decision support systems. And now we'll talk about the artificial intelligence-driven public health interventions and behavioral change. The artificial intelligence is increasingly being utilized in public health interventions and behavioral change initiatives to improve health outcomes and promote healthy behaviors on a larger scale. These interventions leverage AI's ability to analyze vast amounts of data, identify patterns, and provide personalized recommendations. One notable example is the use of AI in chronic disease management. According to a study published in a Journal of Medical Internet Research, AI-driven interventions have shown promising results in managing chronic conditions such as diabetes, hypertension, heart failure. This intervention can include virtual health assistants that provide real-time feedback based on patient data, predictive analytics that help identify at-risk individuals, and personalized treatment plans based on individual health profiles. Another area where AI is making an impact is the mental health. These interventions can include chatbots that provide cognitive behavioral therapy techniques, virtual reality exposure therapy for anxiety disorders, and machine learning algorithms that analyze speech patterns to detect signs of depression or anxiety. AI is also being used to promote healthy behavior through personalized recommendations based on individual data. For examples, fitness applications that use machine learning algorithms to analyze user data can provide personalized workout plans and nutrition recommendations. Similarly, AI-driven nutrition application can analyze dietary patterns and provide personalized meal plans based on individual nutritional needs. In conclusion, AI in transforming public health intervention and behavioral change initiatives by providing personalized recommendations based on vast amount of data analysis. From chronic disease management to mental health promotion and crisis response during pandemic, AI potential applications are vast and hold great promise for improving health outcomes on a large scale. Artificial intelligence-driven public health intervention and behavioral change, the AI can play a significant role in driving public health interventions and facilitating behavioral change. Here is how. Health, number one, personalized interventions. AI algorithm can analyze individual health data, including demographics, medical history, and lifestyle factors to deliver personalized interventions. By tailoring recommendation to each individual's specific needs and preferences, AI-driven intervention are more likely to be effective in promoting healthy behavior. AI-driven public health intervention and behavioral change by personalized interventions. Examples للapplications ديت individualized risk assessment. AI algorithms can analyze individual health data, including medical history, genetic information, and factors to assess each person's risk of developing certain diseases. Based on this assessment, personalized interventions can be designed to target specific risk factors and promote preventive behaviors. Can be used in tailored recommendations. AI can generate personalized recommendation for healthy behaviors based on individual preferences, goals, and constraints. For example, an AI-powered health application can suggest customized exercise routine, dietary plans, stress management techniques that are tailored to each user's needs and preferences. Real-time feedback. AI-driven interventions can provide real-time feedbacks to individuals on their progress toward health goals. This feedback can be delivered through mobile applications, wearable devices, or virtual assistants, allowing individuals to track their behaviors and make adjustments as needed to achieve desired outcome. For the adaptive interventions, AI algorithm can adapt interventions based on individual responses and feedback over time. For instance, if a person is not responding well to a particular intervention, the AI system can adjust the approach or suggest alternative strategies to better suit the individual's needs and preferences. Behavioral prediction. AI models can predict individual behavior patterns and anticipate barriers to behavior change. By understanding the factors that influence behaviors, personalized intervention can be designed to address specific challenges and motivate individuals to adopt healthier habits. Context-aware recommendations. AI-driven interventions can take into account contextual factors such as location, time of day, and social environment to deliver more relevant and timely recommendations. For example, an AI-powered wellness application can suggest healthy eating options, based on the user's locations and dietary preferences. Peer support and social networks. AI can use social networks analysis to identify influential peers and social support networks that can facilitate behavioral change. By connecting individuals with supportive communities and peer mentors, personalized interventions can harness social influence to promote healthier behaviors. Cognitive behavioral therapy tools. AI-powered cognitive behavioral therapy tools can deliver personalized interventions for mental health issues such as stress, anxiety, and depressions. These tools can provide cognitive restructuring, exercise, relaxation techniques, and coping strategies tailored to each individual's needs. Gamification and incentives. AI-driven gamifications technique can make behavior change more engaging and rewarding by incorporating game elements such as challenges, rewards, and competitions. Personalized incentives can further motivate individuals to achieve their health goals and sustain behavioral change over time. Long-term behavioral maintenance. AI can help individuals maintain behavior change over the long term by providing ongoing support, reinforcement, and reminders. By continuously adapting interventions to evolving needs and preferences, AI-driven approach can promote sustained behavior change and improve overall outcomes, health outcomes. In summary, AI-driven personalized interventions have the potential to empower individuals to take control of their health and make lasting behavior change. By tailoring interventions to individual needs, preferences, and contexts, AI can enhance the engagement and effectiveness of public health initiatives aimed at promoting healthier lifestyle and preventing chronic diseases. Predictive analytics. AI can analyze large data sets to predict health outcomes and identify individuals or populations at high risk of developing certain diseases. This information can be used to target interventions proactively, such as early screenings, preventive measures, to reduce the burden of disease. From the AI-driven public health interventions and behavioral change by predictive analytics, the early risk identification. Predictive analytics can analyze large data sets to identify individuals or populations at high risk of developing certain health conditions. By identifying risk factor early, interventions can be targeted toward disease individuals to prevent the onset or progression of diseases. Tailored interventions. Predictive analytics can help tailor interventions to the specific needs of individuals based on their predicted health risks. For example, individuals identified as high risk for cardiovascular diseases may receive personalized recommendation for diet, for exercise, for medication management. Targeted outreach. Predictive analytics can inform targeted outreach effort to reach population most in need of interventions. By focusing resources on high-risk groups, public health initiatives can maximize their impact and reach those who stand to benefit the most. Also, from the AI-driven public health intervention and behavioral change by predictive analytics is the behavioral prediction. Predictive models can anticipate future health behaviors based on past behaviors and contextual factors. By understanding the factors that influence behavior, intervention can be designed to address barriers and motivate individuals to adopt healthier habits. For resource allocation, predictive analytics can inform resource allocations decisions by forecasting future health needs based on predicted health outcomes. This enables public health agencies to allocate resources more efficiently and effectively to meet the need of the population. Interventions effectiveness monitoring. Predictive analytics can monitor the effectiveness of interventions by tracking changes in health outcomes over time. By analyzing real-time data, public health agencies can identify which interventions are most effective and make adjustment as needed. Early warning systems. Predictive analytics can be used to develop early warning systems for disease outbreaks or other public health emergencies. By analyzing patterns in health data, these systems can alert public health agencies to potential threats, allowing for a rapid response to prevent the spread of disease. Healthcare provider decision support. Predictive analytics can support healthcare providers in making informed decisions about patient care by providing real-time prediction of patient health outcomes. Clinicians can tailor treatment plans to individual needs and improve patient outcomes. Community engagement. Predictive analytics can inform community-level interventions aimed at promoting healthier behaviors. By understanding community-level risk factors, public health agencies can design interventions that address the specific needs of different communities and foster community engagement in health promotion efforts. In conclusion, predictive analytic-driven public health intervention has the potential to drive significant improvement in behavioral change by identifying high-risk populations, tailoring interventions to individual needs, and optimizing resource allocation to maximize the impact. By using predictive analytics, public health agencies can better understand population health dynamics and develop targeted interventions that address the underlying drivers of poor health outcome. Also, we'll talk about the behavioral insight. AI-powered analysis of social media, wearable devices, data, and other digital sources can provide insight into population health behaviors and preferences. This insight can inform the design of public health campaigns and interventions that are more engaging and relevant to the target audience. From the AI-driven public health interventions and behavioral change by behavioral insight is the understanding behavior patterns. The AI algorithm can analyze large data sets to identify patterns and trends in health-related behaviors by understanding how and why people make certain choices. Interventions can be designed to effectively target key drivers of behavioral change. Social norms and peer influence. AI can analyze the social networks and peer interactions to identify influential individuals or groups within communities. Using social norms and peer influence can amplify the impact of public health interventions by encouraging behavioral change through social modeling and peer support. Loss aversion and initiatives. AI-driven intervention can use principles of behavioral economics such as loss aversion and initiatives to motivate behavior change. For example, individuals may be more motivated to adopt healthy behaviors if they perceive the potential loss of health or receive rewards for meeting health goals. Goal setting and planning. The AI-powered tools can help individuals set realistic goals and develop action plans to achieve them by breaking down larger goals into smaller, manageable steps. Intervention can increase self-efficacy and motivation for behavioral change. Feedback and self-monitoring. AI-driven interventions can provide real-time feedback and self-monitoring tools to help individuals track their progress toward health goals. By visualizing progress and providing feedback on behavior change effort, intervention can enhance motivation and accountability. Adaptive interventions. AI algorithm can adapt intervention based on individual response and feedback over time. For the mobile health, mHealth application, the AI algorithm integrated into mobile health application can provide personalized recommendations for diet, exercise, medication adherence, and stress management. This application can also offer real-time feedback and support to motivate individuals to adopt healthier behaviors. AI-driven public health intervention and behavioral change by mobile health application, like personalized recommendations. AI algorithm can analyze user data, including health history, activity levels, and preferences to provide personalized recommendation for diet, exercise, medication adherence, and stress management. This recommendation can be tailored to each individual's unique needs and goals, increasing the likelihood of behavioral change. Behavioral tracking and monitoring. AI-powered mHealth app can track and monitor user health behavior in real time, such as physical activity, sleep patterns, and dietary habits. By providing users with insight into their behavior patterns and progress toward the health goals, these apps can increase awareness and motivation for behavioral change. The predictive analytics. AI algorithm can use predictive analytics to anticipate future health risks and provide proactive interventions. For example, an application could alert users if they are at risk of developing a particular health condition based on their behavior patterns and recommend preventive measures to mitigate the risk. Adaptive interventions. AI-driven mHealth application, mobile health application can adapt intervention based on users' responses and feedback over time. By learning from user interactions, these apps can personalize the user experience and tailor recommendations to better meet individual needs and preferences. Real-time feedback and coaching. AI-powered mobile health application can provide real-time feedback and coaching to users to support behavioral change efforts. For example, an application could provide encouragement or tips to help users stay on track with their health goals, or offer suggestions for alternative behaviors if users are struggling to meet their targets. Chatbots and virtual assistants. AI-driven chatbots and virtual assistants can deliver personalized health advice, answer user questions, and provide support and encouragement. These digital campaigns are available 24/7 and can engage users in conversations to help them make healthier choices and overcome barriers to behavior change. Gamification. AI can enhance gamification features in mobile health application to make behavior change more engaging and rewarding. For example, application can use game elements such as challenges, rewards, and leaderboards to motivate users to adopt healthier habits and sustain behavior change over time. Social support and community engagement. AI-powered mHealth application can facilitate social support and community engagement by connecting users with similar health goals or interests. By forecasting a sense of community and accountability, this application can increase motivation and adherence to behavioral change interventions. Integration with wearable devices, AI-driven mobile health application can integrate with wearable devices such as fitness trackers and smartwatch to collect additional health data and provide more accurate insight and recommendations. This seamless integration enhances the user experience and improves the effectiveness of behavioral change interventions. In summary, AI-driven mobile health application have the potential to make a revolution in the public health interventions by providing personalized recommendation, real-time feedback, and support to help individuals adopt healthier behaviors and improve their overall well-being. We'll talk about the chatbot and the virtual assistants. AI-driven chatbot and virtual assistant can deliver health education, provide self-care advice, and answer questions about preventive measures and treatment options. From the AI-driven public health intervention and behavioral change by chatbot and virtual assistants, applications and example is the 24/7 accessibility. Chatbot and virtual assistant powered by AI are available around the clock, providing users with immediate access to health information and support whenever they need it. This accessibility increases engagement and encourages individuals to seek guidance for behavior change at any time. Personalized health advice. AI algorithm enable chatbot and virtual assistants to deliver personalized health advice based on users' unique profile, including demographic information, health history, and behavioral pattern. Tailored recommendation increase the relevance and effectiveness of interventions, motivating individuals to adopt healthier behavior. Behavioral coaching. Chatbots and virtual assistants can provide ongoing support and coaching to help individuals set and achieve health goals. Through personalized conversations, they can offer engagement, reminders, strategies to overcome barriers to behavior change, empowering users to make positive lifestyle change. Also from the application is the health education. AI-driven chatbot and virtual assistant can deliver health education materials in a conversational format, making complex information more accessible and understandable to users. By providing accurate and engaging content, they can enhance health literacy and empower individuals to make informed decisions about their health. Behavioral monitoring and tracking. Chatbots and virtual assistants can track user health behaviors and provide real-time feedback on their progress toward goals. By monitoring behaviors such as physical activity, diet, medication adherence, they can help individuals stay accountable and motivated to maintain healthy habits. Prompting behavioral change. Chatbot and virtual assistant can prompt individuals to engage in specific health behaviors through timely reminders or prompts and nudges. By using principles from behavioral economics and psychological, they can influence decision-making and encourage users to take actions that contribute to improved health outcomes. Emotional support. The AI-powered chatbots and virtual assistants can offer emotional support and empathy to users experiencing stress and anxiety or other mental health challenges. Through empathic responses and active listening, they can provide reassurance and guidance to individuals in need of support, promoting overall well-being. Risk assessment and prevention. Chatbot and virtual assistant can conduct risk assessment based on user health information and provide recommendations for preventing measures. By identifying potential health risks early and offering proactive intervention, they can help individuals reduce their risk of developing chronic diseases and other health problems. Adherence to treatment plans, chatbots, and virtual assistants can help individual adherence to treatment plans by providing reminders, tracking medication schedules, and offering support for lifestyle modification. By promoting adherence, they contribute to better health outcome and disease management. In summary, AI-driven chatbot and virtual assistant have the potential to transform public health intervention by providing personalized support, education, and encouragement to individuals seeking to improve their health behavior. By using AI technology, they can deliver accessible and effective interventions that empower individuals to take control of their health and well-being. The next step is the gamification. AI can enhance gamification intervention designed to motivate behavioral change by providing personalized challenges, rewards, and feedback. Gamification technique increase engagement and adherence to health goals by making behavior change more enjoyable and rewarding. From the AI-driven public health interventions and behavioral change by gamification, engagement, and motivation. Gamification techniques such as challenges, rewards, and leaderboards can make behavioral change more engaging and motivating by transforming health-related activities into a game-like experience. Individuals are more likely to stay committed to their goals and persist in adopting healthier behaviors. Goal setting and progress tracking. AI-powered gamification platforms enable users to set personalized health goals and track their progress over time. By visualizing achievement and milestone, individuals gain a sense of accomplishment and are motivated to continue making positive changes in their behavior. Personalized challenges. AI algorithms can analyze user data to generate personalized challenges that align with individuals' interests, preferences, and capabilities. By tailoring challenges to each user's unique profile, gamification platforms ensure that interventions are relevant and engaging, increasing the likelihood of behavioral change. Social interactions and support. Gamification platform can facilitate social interactions and support by allowing users to connect with friends, families, or peers who share similar health goals. By fostering a sense of community and collaborations, individuals are motivated to engage in healthy behavior and support each other's progress. Feedback and rewards. AI-driven gamification platform provide real-time feedback and rewards to users for achieving health-related milestone or completing challenges by offering immediate reinforcement and positive reinforcement. Individuals are encouraged to continue making progress towards their goals and sustaining behavior change over time. Behavioral reinforcement gamification techniques can reinforce desired behaviors by associating them with positive rewards or incentive. By creating positive associations with healthy behaviors, individuals are more likely to adopt and maintain their behaviors as part of their daily routine. Skill building and education. Gamification platforms can incorporate educational component to teach users about health-related topics such as nutrition, exercise, or stress management. By combining gameplay with learning opportunities, individuals gain knowledge and skills that empowers them to make informed decisions about their health. Adaptive challenges. AI algorithm can adapt gamification challenges based on user progress and performance over time. By adjusting the difficulty level or complexity of challenges, gamification platform ensures that intervention remain engaging and challenging, motivating individuals to continue striving for improvement. And long-term engagement, gamification platform can promote long-term engagement by offering new challenges, activities, or rewards on a regular basis. By providing fresh content and experiences, individuals are encouraged to continue using the platform and maintaining their commitment to behavior challenge. In summary, AI-driven gamification offers a promising approach to public health interventions by making behavioral change more engaging, motivating, and sustainable. By leveraging gamification technique and AI technology, interventions can empower individuals to take control over their health and well-being in a fun and interactive way. Now we'll talk about the social network analysis. AI technique can analyze social networks to identify influential individuals or groups within communities who can serve as advocates for health promotion. Using social networks can amplify the reach and impact of public health interventions by harnessing peer influence and social norms. From the AI-driven public health interventions and behavioral change by social network analysis, identifying influential nodes. AI algorithm can analyze social network data to identify influential individuals or groups within communities. These influential nodes can serve as key opinion leaders who can drive behavioral change among their peers. By targeting interventions towards these influential nodes, public health efforts can have a greater impact on the entire network. Peer influence and social norms. AI-driven social network analysis can uncover patterns of peer influence and social norms within communities. By understanding how behavior spread through social networks, intervention can use social influence to promote healthier behavior. For example, intervention can encourage individuals to adopt healthy habits by showcasing the behaviors of their social connections. Network mapping. AI algorithms can create visual presentation of social networks, highlighting connection between individuals and groups. These network maps can help public health practitioners identify clusters of individuals who are more likely to adopt similar behaviors. By targeting interventions towards these clusters, public health efforts can be more efficient and effective. Community engagement. AI-driven social network analysis can facilitate community engagement by identifying community leaders and stakeholders who can help promote public health initiatives. By involving community members in the design and the implementation of interventions, public health efforts can be more culturally sensitive and responsive to community needs. Tailored messaging and intervention. AI algorithm can analyze the social networks data to tailor messaging and intervention to the specific characteristics of different social groups. By understanding the social dynamics within communities, intervention can be designed to resonate with the value beliefs, and norms of different social groups, increasing their effectiveness in promoting behavioral change. Peer support networks. AI-driven social network analysis can identify existing peer support networks within communities where individuals provide emotional support and encouragement to each other. By using these peer support networks, intervention can foster a sense of community and collectively efficacy, empowering individuals to support each other in making positive behavioral change. And finally, in measuring intervention impacts, AI algorithm can measure the impact of the interventions on social networks by tracking change in network structure and behavior patterns over time, by monitoring how intervention influence social connections and behaviors within communities. Public health practitioners can assess the effectiveness of their effects and make data-driven decisions to optimize future intervention. In summary, AI-driven social network analysis offers a powerful tool for driving public health interventions and promoting behavioral change. By using insight from social networks, intervention can be targeted, tailored, and optimized to effectively engage communities and catalyze positive behavioral change at scale. Now we'll talk about the policy and resource allocation. AI-driven predictive models can inform public health policies and resource allocation decisions by forecasting the impact of different interventions on population health outcomes. This data-driven approach maximizes the efficiency and effectiveness of public health efforts. AI-driven public health intervention and behavioral change by policy and resource allocation. Example, in the predictive modeling, AI algorithm can analyze large data set to predict future health outcomes and identify population at high risk of certain diseases or health conditions. This information enable policymakers to allocate resources proactively to prevent disease incidence and improve population health. Targeted interventions. AI-driven predictive models can identify demographic or geographic areas with the highest burden of disease and prioritize intervention accordingly. By targeting resources to population most in need, policymakers can maximize the impact of public health interventions and promote behavior change where it's most needed. Resource optimization. AI can optimize resource allocation by identifying cost-effective interventions that yield the greatest health benefits. By analyzing the cost-effectiveness of different intervention strategies, policymakers can allocate resources efficiently to achieve maximum impact on behavioral change and health outcomes. Policy evaluation. AI-driven analytics can assess the effectiveness of existing public health policies and interventions by analyzing real-time data on health outcomes and behavioral change. This information enables policymakers to make data-driven decisions about which policies to maintain, modify, or expand to achieve desired health goals. Health equity. AI can help policymakers address health disparities and promote health equity by identifying vulnerable populations that may be disproportionately affected by certain health conditions. By targeting intervention to address underlying social determinant of health, policymakers can reduce disparities and improve health outcomes for all populations. Dynamic decision-making. AI algorithm can adapt to changing conditions and provide policymakers with real-time insight to inform decision-making. For example, AI can analyze emerging health trends or outbreak and recommend timely intervention to mitigate risk and promote behavioral change. Surveillance and early warning system, AI-driven surveillance system can monitor health data in real time to detect early signs of disease outbreaks or public health emergency. By providing early warning, policymaker can implement timely intervention to prevent the spread of disease and promote behavioral change to reduce transmission risk. Policy simulation and scenario planning, AI can simulate the potential impact of different policy interventions and behavioral change strategies to inform decision-making by modeling various scenarios. Policymaker can assess the effectiveness of different approach and identify the most promising strategies for achieving desired health outcomes. And finally, data integration and interoperability. The AI can integrate data from multiple sources, such as electronic health records, social determinants of health, and environmental factors to provide a comprehensive understanding of populations' health. By integrating diverse data sources, policymakers can make more informed decisions about resource allocation and policy development. In summary, AI-driven approach to policy and resource allocation has the potential to transform public health interventions and promote behavioral change by providing policymakers with timely, actionable insights to inform decision-making and optimize resource allocation for maximum impact on population health. يبقى احنا اتكلمنا عن ال Artificial Intelligence Driven Public Health Intervention and Behavioral Change. اتكلمنا in details عن ال Personalized Interventions, ال Predictive Analytics, Behavioral Insights, Mobile Health Application, ال Chatbots and Virtual Assistant, ال Gamification, ال Social Network Analysis, وال Policy and Resource Allocation. Overall, AI-driven public health intervention hold great promise for promoting behavioral change, improving health outcomes, and reducing the burden of preventable diseases at both individual and population levels. Thank you very much. If any question, please send me in the chat. أشكر حضراتكم، شكرا جزيلا. لو في أي حاجة مش واضحة أستأذن حضراتكم ابعتوا لي في الشات. شكرا جدا. ميرسي خالص، شكرا لحضراتكم. السلام عليكم.